Good morning, Guam. Good morning.
Howdy.
.614, it's the KUAM News Takeover of Guam's favorite, kicking it off there with a little bit of a netnon gef pagu with Singwaizahau Guahan. Good morning, Banana Seedus, and welcome to the show. Real information in real time, and there's just so many ways you can contain COVID and help us kill the curve, because we got the power! All right? We're streaming live right here on the radio, 93.9 FM. There's also an audio stream, Docomo Channel 10. We're live streaming KUAM.com and the KUAM News app, and Facebook Live, our KUAM News Facebook page. Thank you so much to all of our viewers all over the world, including checking in from Ellicott City, Maryland.
Wow.
Angie Borja. Good morning, Angie. And we got Jason Solis this morning, so you know he's so interactive, and he is going to be he's going to be he's a little over interactive. He's going to be reading off your comments, your questions, your concerns. Some of the things that we have planned for you guys this morning. Logistically, how possible is it to conduct mass testing with tens of thousands of South Korean test kits? We'll find out the answer to that question, hopefully, this morning. And then we'll also go in a little bit with Dr. Doom. That's a little nickname that we have given Dr. Felix Cabrera of the Physicians Advisory Group. That's the group of doctors that advise the governor. Also on a slate this morning, TAG Esther Agagi, the Adjutant General of the Guam Army National Guard, and a whole lot more. It's 6:16, as we always do. Let's start the show with a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Salas-Matanani.
Half a day and good morning, everyone. According to the latest from the Joint Information Center released at 9:45 last night, Public Health tested 34 individuals for COVID on Wednesday. 0 tested positive. However, there is one additional case that tested positive through U.S. Naval Hospital, Guam. So this brings the total number of confirmed cases of COVID-19 on Guam to 137, with 5 deaths and 119 recoveries. Recovery, again, means a patient is no longer considered infectious. According to the U.S. Centers for Disease Control and Prevention, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. Public Health is gearing up for their community pilot testing project at the Estumbo Gym, scheduled for this Saturday. Public Health Director Linda DeNorsi says the facility is ideal because it's gated and it can control the traffic coming in and out.
The reason why we're having it at the Estumbo Gym is because a lot of the targeted group that we're emphasizing on is living in areas, as I mentioned, that they don't have transportation. So we want to make sure that we cover these barriers to care. And so that's the reason why we want to do both the drive-through simultaneously with them walking straight up to our staff, and they'll have the nasopharyngeal swab. So we'll have 3 teams that will be working on this. The gym is ideal because also it's a gated, and we can control the traffic coming in and out. We also will have the tag. The tag will have her team with the National Guard to control the traffic, and also the security will be in place with our Guam Police Department. We'll also have the emergency response team there in the event anybody should have any emergency issues. And of course, one physician will be available during this time. We also have decontamination procedures. So we have to ensure that our staff, our nurses, will don all their PPE, and they will decontaminate themselves as they get in contact with patients. And so in a nutshell, we're also going to advertise it through the mayor, of course, and our staff. And that information will be disseminated to them. And we're hoping that this pilot project, which we're aiming to just get a small count to start off with, as it's called pilot, so that we can be able to identify these areas that they may not have presented themselves to the clinic, because again, as I mentioned, they may have no insurance, they may be uninsured, they may have barriers to care like transportation. They can't get to the clinic for whatever reason. They don't have a car, or they don't have anybody that can drive them. They can't take the bus or whatever. We're doing social distancing. So these are the reasons why we want them in these pocket areas. And so by getting that type of information, we can identify anyone that could be infected, regardless of their ethnicity. And once we identify if there is an infection there, we then launch our team to begin the investigation, to do the contact tracing. So later on, when we know that this person is positive in the household, we can identify contacts, i.e. household contacts and close contacts, so that we also want to test those in the household with this positive person to determine if they, even though they're asymptomatic, we want to test them. And of course, we don't want everybody in the household. We want to make sure that there's no cross-contamination occurring so we can control the transmission of this disease. And by doing so, we will assess if they have a condition in their home that's suitable for all of them to live in. If it's not suitable, meaning you may have an elderly in that household with that positive patient, or another family member that has also comorbid conditions, we don't want all of you in that house. So what we'll do, we'll take out the person that is positive and put them in our government of Guam isolation areas. And then from there,
flu such as cough or runny nose to come forward to be tested. Denorsi says for those testing positive, they'll then begin contact tracing to identify others in the family who may be infected. That Estumbo Gym pilot project is scheduled for 9 a.m. to 12 p.m. Again, that is this Saturday. Meanwhile, with increased testing capabilities and Guam entering this new phase of testing, it will help in the governor making her ultimate decision in reopening Guam.
So you mentioned in your opening.
I am very concerned about our people, of course. I'm very concerned that we keep them safe. I'm concerned that we keep them healthy, of course. And I'm concerned that.
So you mentioned in your opening statement and that it's, up to the community. It could be 2 weeks or 2 months. Do you foresee a possibility of opening in 2 weeks? And have you given thought to which businesses you would allow to open up first?
So these questions are being reviewed by our recovery panel advisors, Nestor, and it's very dependent on whether it's 2 weeks or 3 weeks from now. Is dependent on the data and information we are going to be getting in the next 2 weeks with our expanded testing. And so I mentioned yesterday what are the triggers, right, to indicate to start opening or start loosening some of our restrictions. And of course, capacity of the hospital is one. Its ability to be able to take care of COVID patients if we start seeing surges. The 14-day period, which is 14 days from the last case that you see or the lowest case, 14 days forward is where the time frame is being looked at. And then, of course, our capacity to test. I really believe that we will have all of these three criteria met. And we have to have these criteria met before we actually decide on opening. I would like to look at businesses first and maybe open also some selected public services with our government. And then we can go from there. And what we would do, Nestor, is as we relax our restrictions, of course, we're going to continuously be diagnosing, monitoring, isolating, quarantining, so that we can.
This Friday. Thousands continue to line up for food through the Guam DOE Grab and Go Meals program. More than 1,000 have applied for public assistance and federal aid via stimulus checks and unemployment assistance. COVID has had a dire impact on island residents. The question continues to be asked by local media, what about local assistance to bridge island residents until federal financial help arrives?
I am very concerned about. I am very concerned about our people, of course. I'm very concerned that we keep them safe. I'm concerned that we keep them healthy, of course, and I'm concerned that they're able to provide for their families. And that's why we advance the economic recovery program forward. We are also looking at speeding up our tax refunds because we still have those that would be available for our people. And of course, public assistance is there. And we've been tracking the public assistance volume and eligible people that are enrolled, and we have been seeing about a 59% increase in public assistance. That's your cash assistance program. That is your SNAP, because there is a cash assistance program through public health. We have a SNAP program, which is your food stamps, and of course, MIP with your health care and Medicaid also. So there are currently existing local government assistance to help our people. Additionally, with these people that already have approved with their pay protection loan program, those businesses can continue employing these individuals. So even though the business is not open, but you now have a loan with the pay protection program loan, then you can continue paying those employees so that they can continue to have the means and the income to provide for their families. And of course, you know, that program is such that if you, whatever percentage that you are using to, from your loan to pay for your payroll, that loan portion will be forgiven. And so it's really a method to give outright federal grants to encourage employers to continue employing their individual employees.
And runs through April 28th. The summit is being held in conjunction with Graduate School USA. Attending are members of the legislature there, business leaders, and members of the public to address the Commonwealth's fiscal challenges as a result of COVID. The summit will build upon the findings of the governor's fiscal response task force. As reported, CNMI Governor Ralph Torres weeks ago announced the furlough of government employees as a result of seeing a reduction of almost 50% in their budget because of COVID. Additionally, PSS employees have a payless payday. There are 14 confirmed cases of COVID-19 in the CNMI. As for the latest with the USS Theodore Roosevelt, according to the latest numbers released early this morning, 99% of the crew have been tested for COVID-19, with 777 total positive and 3,919 negative. Of the total positive cases, 63 sailors have recovered, 4,196 sailors have moved ashore, 6 sailors assigned to USS Theodore Roosevelt are at Naval Hospital Guam, and none of the sailors are in ICU. Meanwhile, sailors in quarantine at the hotels will remain in Tumon longer than initially planned. According to the governor, she was informed by Joint Region Marianas Commander Rear Admiral John Manoni they need an extended stay. The governor saying Manoni had hoped to have everyone back on the ship by this weekend, but the Navy wants to keep them for one more week to make sure they go beyond the 14-day quarantine, which is the life cycle of the virus, to make sure that when they set out to sea, they won't have any incidents of COVID. On Wednesday, the Navy announced that 42 sailors that initially tested negative had tested positive for COVID. Currently underway, the Navy, along with the CDC, are conducting a serology study into the outbreak on the carrier. Results aren't expected for about 1 month. In national news, the Senate has passed a bill aimed at keeping people employed during the coronavirus pandemic, and now it heads to the House for a vote there. This comes as President Trump is focused on reopening the economy and getting the 22 million Americans currently on unemployment back to work. Skylar Henry has more details from the White House.
Thank you very much, Mr.
House Speaker Nancy Pelosi says she believes the House will pass a nearly $500 billion stimulus package tomorrow.
We're in a tradition of having this be the fourth bill that we will be passing in a bipartisan spirit.
The deal includes $310 billion for small business loans to keep workers on the payroll, $60 billion of which will be set aside for smaller banks and lenders.
Until we can begin to open up the economy, we can't spend enough money to solve the problem.
It also includes $25 billion for coronavirus testing.
We will not get America moving again until we have a nationwide, well-thought-out, well-executed testing program.
While the stimulus package was designed to keep workers employed, President Trump says he's taking another step to ensure American citizens are the first to be hired as the economy reopens.
It would be wrong and unjust for Americans laid off by the virus to be replaced with new immigrant labor flown in from abroad.
The president says he'll sign an executive action today to suspend immigration. It's expected to pause green cards for 60 days.
By pausing immigration, we'll help put unemployed Americans first in line for jobs as America reopens. So important.
The president says the order will not impact workers coming to America on a temporary basis. Skylar Henry, CBS News, the White House.
COVID-19 is going to take all of us to do our part. We're all on the front lines of this epic battle. And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now. It is part of a global initiative setting aside this one day specifically for the pandemic crisis. to step up and give a donation to any of our island's nonprofit organizations, whether it be the hospital, Mayor's Council of Guam, or any other frontline heroes. It could be PPEs, gloves, masks, canned goods. No donation is too small. Anything and everything will help. And when you do make your donation, take a picture, post it on social media using the hashtag GivingTuesdayNow and Giving Tuesday Guam. Then later that evening on Tuesday, May 5th, join us for a half-hour special showcasing how Guam gives.
There you go. That's going to be good. 6:31, KUM News takeover of Guam's favorite containing COVID. That, of course, was Sabrina Salas-Mantanani with a look at the day's COVID-19 news. I lost $20 last night.
Why?
Because I bet there was going to be 0 positives. And turns out there was actually one from Naval Hospital, right?
Yeah.
And so we've got, Dr. Felix Cabrera coming on to talk about this new trajectory that says a new peak September, October. And everybody now wondering, what does that mean for this May 5th, the May 5th is supposed to be the end of this current social isolation order. So I think that's probably going to be a good question to ask.
Well, I think also the governor will probably look at the results as they come out from the pilot testing program up at Estumbo. And, I mean, we don't know how soon after that we're going to see more tests being conducted in other villages. But that's, about a week or so?
Yeah. And she's going to weigh the results of the testing with what her economic recovery council or group tells her recovery panel of advisors. And so they're supposed to present their plans to, reopen Guam in baby steps.
Yeah, and then that's a major factor is the results, because now we have the testing capability. Right now, the hospital, there's not a lot of patients there for COVID.
Right.
So everything seems to be in place, just hopefully the results don't climb.
Right, and I guess that's what we're all waiting for. So remember, the message up to this point has been stay home, but we have a new message for you. The new message is go out and get tested, okay? The criteria, we're going to go over that. What the criteria is, I know you got that.
Well, yeah, it's basically if you have any cold, flu-like symptoms that you need to get tested, call your clinic, let them know how you're feeling, and then they'll immediately bring you in. And then for the people in Estumbo that live in that area, you'll need to go get tested.
Right, and so we're getting a lot of questions. Linda kind of yesterday really expanded on what it will take for you to get tested, and then another criteria she mentioned is if you have any chronic illness, like diabetes or any existing comorbidities that would make you more susceptible to, really getting hurt by COVID-19. 6:33, we're going to take a little break. We got Rachel from the Department of Public Health coming on to the show this morning. Again, it's the 23rd day of April. KUAM News takeover of containing COVID is proudly brought to you by Ambrose Inc. and IT&E. Good morning.
Ambrose Inc. Keeping you informed, KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the People's Bank.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with IT&E. Be healthy. Be informed with IT&E.
Self-Storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
To get tested Saturday. Stumbo 638. It is the 23rd day of April. Over 40 days under mandatory social isolation and lockdown orders. Now the conversation turning to reopening the island, but only after we have conducted community testing. We spoke with several mayors yesterday. They got the word, right, Bree, that where community testing will take place, at least in a couple villages, but they might have got the where, they haven't got the when yet.
Right, and they're all working with the Mayor's Council of Guam President, Melissa Zavares, and actually she's going to be the pilot program for the community testing this Saturday, and I believe we have her on the phone now.
Yeah, we do. So good morning, Mayor.
Good morning.
Hi.
So just about 1.5 million questions rolling in about this Stumbo pilot program testing. Mayor, I guess just take us to where we're at now with the current status, what you're working on, and what it's going to look like Saturday, 9 a.m.
Yeah. So, the community testing is going to be for the immediate community around the gym area. So, it's to target the immediate neighborhood. Of course, during any type of outreach, they bring outreaches into the community where people have limited access to health care. So this is going to address those families or individuals who feel that they need to get tested because they have some mild symptoms, and they'll be able to have access to that.
Mayor, now you said that it was for the immediate Stumbo.
Second Lanatan?
The immediate. Can you just be a little more specific on what you mean by that? So does that mean that only people from that area will be able to go and get tested?
So like I said, this is a limited outreach for, they want to do community outreach and community testing. So the target to go out for public health going out into the community is to give access to to residents who cannot, say, drive to a private clinic, a health care center, or to the northern or southern health center. They maybe because of lack of transportation. So this community outreach, from what I'm understanding with Department of Public Health, will be addressing the immediate neighborhood. So the Sagan Linazan area is the area that they're going to address because that's the area immediately surrounding the gym.
And how many residents are in that area, in the Sagan Linazan area?
There's 80 homes from the Sagan Linazan area, and so we're the public health team. They're called their ECHO team. Will be canvassing the area starting this morning. They were preparing flyers. They just needed to finalize some information on the flyers, just indicating to the residents that if you have mild symptoms that you would like to, and there'll be a list of symptoms on the flyers, there'll be opportunity for screening, community screening at the gym on Saturday between 9 a.m. to 12 noon.
Mayor, I think in the press conference, Linda had said something that there would be a drive-up option and then also a walk-up option. Is that still accurate?
Yes, it's still accurate.
And then what are the flyers that they're passing out? Are those in English, or are they broken down into different languages maybe?
The one that I saw is in English, and then we do have some translators that will be. We were able to connect with some Tupi translators. We have some Chamorro speaking, and then of course Tagalog.
You said 80 homes. How many people does that equate to? Break down to?
Sabrina, you know, some of these homes have multiple families, 2-3 generations of families living in these homes. So roughly about maybe about 400 or 500 people. Of course, not everybody's going to get tested, right?
Is that the goal, though, Mayor, to get everybody there tested?
Well, you know, those that feel that are interested in getting tested, of course, like I had mentioned to Public Health yesterday, because we have multiple families, multi-family units living in these households, you know, you have 2-3 generations, parents, grandparents, and children. So, which age group would you be more concerned about? Those that are 40 and over, 50 and over? Of course, those elderly, but if they're not asymptomatic, then of course they don't. And everything is with, voluntary testing, screening.
You know, Saginaw-Lanazan, it's a pretty dense community. The homes are small, they're really close together. And what is the plan if you have one household that has a high number of positives, and they're not big homes, they're really small.
They are very small.
Right. So what's the plan if you have a household or you have like 1 or 2 people that test positive in that home? How do you isolate them and not have them have contact with other people in that same house? And if we're looking at, let's say it's 400, 500, say they test 200, where are we going to put all these people?
Well, of course, you know, Sabrina, Public Health has their surveillance team. They would address it if those concerns come up. I believe.
But they hadn't presented that sort of contingency plan to.
Well, I know in the press conference
that's
yesterday,
got to be concerning.
Linda had said that if your home doesn't meet CDC guidelines, then they're going to put you in the government isolation facility.
Well, it depends on how many rooms are at the government isolation facility.
Right, and then would they then put, if we have a house of a family, maybe like 7 or 8, 3 of them test positive. Yeah, I wonder logistically, are they going to take those 3 and put them in the isolation facility and then have I don't know. Obviously, they're still kind of working through these things, right, Mayor?
Yeah, obviously. So I have, they want to do community-based testing. As mayors, and I've spoken to my colleagues, our facilities are available, and so that's our part, is that we make the facilities available. Okay.
But they're not going to go inside the gym, are they?
No,
everything is outside. Okay, there's no need.
What we've done, especially at the gym, is because it's community-based, right? There's people that don't have transportation. We've already made lines, social distancing lines on the, 6 feet apart.
Right.
So you're not going to hang up against the wall and have your conversations with they'll be distancing in the walking lines as well.
So for residents in Saginaw-Lanazan that want to go to the testing site, what do they need to have IDs with them, masks on?
Everybody must have a mask on. We see most people walking around, driving around, even with the mask. So that would be, of course, very important. You must have a mask. I'll hand you a mask if you.
So you have some masks for those people who don't have, can't afford it.
Right.
What about people with disabilities that can't make it there? Are we going to see Public Health go to their homes and test them?
If they live within the testing area, yes.
Okay.
Mayor, what are your constituents saying about wanting to get tested? Or what are you hearing? Is this something that they want to do, or are we having a hard time? Is there any fear of the doctor going on?
People that call our offices, and this is throughout the island. Whenever because I get calls from mayors every day. Somebody wants to get tested. After my meeting yesterday, I got a call and said, well, the people in another village want to drive all the way up to Dedido on Saturday morning. So I told them, I said, if they're really adamant about getting tested, they can drive to any health center, northern or southern, and somebody will be at the front to screen them. And then if they meet the criteria, they will be swabbed. They can also go if they have a private physician. Private clinics are also doing testing. So there's no. We're not saying that you can only come to these outreaches to do your testing. You can go to any community health center, which is Northern and Southern Public Health. Come drive to the front. Say you want to get tested. There is a questionnaire that the nurses or the staff would ask, and then if you meet those criteria, then of course you're going to get tested. So
right, I get it. This is for the most vulnerable population, people who don't have the ability to travel. So you guys are bringing this clinic to them.
We're working on the messaging, Mayor. I think when the governor is out there saying that we want to test so many people, we want to test 258 people a day, people hear that, they automatically think, I'm going to go get tested. When they hear that we're going to do a pilot program in Estumbo, and the messaging is that we want to test so many people, of course people are thinking they can just go show up at Estumbo, because I believe in one of the press conferences they might have even said that.
Yeah, right. So, like I said, as mayors, we're here to provide the facility in the areas that are that they want to do. And so I'm doing a pilot. And so I continue to hear at the press conferences that it'll be community-based testing. And then, when you come to the table through these meetings, I'm hearing, well, it's going to be this particular housing area, and then how much can we do around it. So, of course, we have the team that will be going out with, and they're a team of nurses that will be going out to do, and these are nurses that go out anyways for Project Visita. They do community-based checks on.
So they're familiar.
They're familiar with the families that live there. Yeah, they're familiar with the families that live there. So, they're not, they're not new to this. These are neighborhoods that they usually work in anyways.
What about so this is the pilot project, but obviously Dedido is the largest village on Guam. So where else are they looking at conducting this community testing?
I know that they also want to hit like Vigo.
Right. I meant specifically in Dedido.
Yeah. Specifically in Dedido, I think this would be the one area in Dedido. Because there's a facility. One thing that they look at is there a facility where they can bring stuff into a room? Of course, the people coming are driving through or walking through. They do their business, walk in, do their business, and leave. So, you need to make sure that, but the people that are swabbing or working and, directly asking questions, they're there for 4 hours. Are there restroom facilities for these individuals that are doing these testing or surveillance or whatever it is that they're going to do? So they need to make sure that if they're going to go into a village, we're not going to intrude in somebody's home or garage and say, hey, we're going to do this in here. Can we use your toilets? Can we use your garage? Can we use your living room to store the coolers or whatever? They need to make sure it's a common area where their facilities are available for the people that are going to be doing this task. So most of those areas are areas where mayors have facilities. Department of Parks and Rec has a facility in these areas. That kind of stuff, right?
Yeah, but you also have areas that you don't have facilities, like Swamp Road. That's a pretty long stretch of road. I mean, is that one of the areas that have been identified that they were looking at?
It's not an area that has been identified, but Swamp Road is in pretty close proximity to Delito Public Health.
Mayor, we spoke with Mayor Soswico and Mayor Mantanani yesterday morning, and both of them have been told about where community testing will take place in their respective villages. They expressed a little frustration, though, about not knowing when community testing will take place, because, as I'm sure you know, when we put out this information, people hear it, they want to start planning to get tested. So have you heard anything else about any other timelines for any other community testing in any other villages?
I don't have a timeline for the other villages, and I'll tell you, I speak to my colleagues all the time.
Right.
Mayor Soswico and Mayor Matsanani, and of course, because they too are anxious. I mean, even the PD mayor, who's not scheduled yet, has said, oh, they're going to drive to Estevez, so just tell them that the mall is closed, because when they drive up, there's nowhere else for them to. There's no other places, and so because it's community, so as far as the timeline and when they're going to go, I don't have a schedule.
Okay. I did want to ask about the results. Did they tell you that they were going to be giving the results there? Because those Abbott ID Now tests, they are, mobile, and they can spit out results within X amount of minutes. Did they tell you that they would be getting the results on site, or compiling it and announcing it later that evening?
Yeah, well, announcing it later. What it is I know that how they're going to do it is put the specimen in the containers and then take it to the lab. So somebody from the lab will be there to transport. I don't know how often. Are they going to do it every hour or whatever? So there will be somebody from the lab to take the specimens and take it to the lab to get tested.
Mm-hmm. Did they say which lab? GRMC or Public Health? Or
I'm not clear. I
okay.
heard a name. I didn't know which particular lab though. Okay.
Anything else you wanted to get out to the community about the testing this Saturday?
No, just keep reminding people that, if they really, really feel that they need to get tested, there are other facilities that they can drive up to.
Right. Yeah, that's what we're trying to do, Mayor, to change the message. The message has been stay home. Now the message is go get tested.
Yeah, if they
it's
feel
free.
that it's necessary. If it's free, if they feel it's necessary.
Okay, so and you're kind of doing the same thing, right? I know that you're close with your constituents. Are you going out here and then telling people like, hey, we got to get tested. If you want to reopen the island, we got to get tested.
Yeah, of course. As a matter of fact, my staff who deliver meals to the Manamcos, I just told them yesterday I wanted them to get tested, and they looked at me like, but we don't come in direct contact. They're giving through bags, through doors, and so. As long as they don't feel any symptoms, I'm not going to push it.
Right.
Mm-hmm.
But, of course, like you said, we want to reopen the island.
Mm-hmm. Yeah. There was one thing that you had requested actually during when the dashboard was released and the information that you guys received. You were looking a little bit more for specifics in terms of Delito is really huge. Which neighborhood are the positives in? Are you aware of Sagan-Linazan, if there are positive cases there?
I'm not aware of any positive in Sagan-Linazan, but we do have, I only because we've helped transport patients back home in the outskirts of the village, outside of the Sagan-Linazan area. And it's like one or two that I know of.
Mm-hmm. Okay, but a majority of them have recovered. In your
more
village.
Than half of ours have recovered.
Are they recovered, Mayor? Do you trust their recovery criteria? Because I heard something in the press conference that it kind of just caught my ear, and that the Roosevelt sailors, the Navy wants to keep them here a week longer than the 14-day period because they just want to be really sure that when they go out to sea that, the virus doesn't pop up again. So I kind of thought, well, if the military is adding an extra week onto it, and the CDC guidelines are what they are we now going to maybe do that as some kind of precaution, or are we just going to keep churning recoveries out?
The individual, I've actually transported 2 people home, and they said, you know what, we need to remember to hygiene, washing, all these kind of things,
right.
Wearing the mask all the time. They said that's something they'll never take for granted anymore,
mm-hmm.
and always have to do. So, they've recovered. They know what it feels like to be there. in that area, that condition. So, ever want to be. They wouldn't even wish that against their enemy.
Wow.
By any chance, do you have a copy of this brochure, or can
Mayor.
take a picture of it, and we can just be reading it on the air?
Yeah, just to get the word out. We want to help.
Yeah. As soon as they because they just needed to change the location on the flyer. As soon as they send that to me, I'll send it to you.
Mayor, I just wanted to ask because a lot of people thought that they were going to be getting the stimulus checks by now. A lot of people thought that they were going to be getting the unemployment assistance by now, and we actually find out that that's weeks away, maybe even a month away for the unemployment. And people were told to hang in there. They were told to apply for food stamps. Dedido being the most populated village, what are you seeing in terms of people really just now hitting a new rock bottom? With the grab-and-go meals, with the various assistants out there, are your constituents in a new world of hurt because we're not getting the help that we thought was going to be here by now?
Chris, every day I have 2 staff that are working in the office. We're only taking phone calls, and we're sending, but we've seen an increase of public assistance applicants. Of course, they have drop boxes, and We've been actually printing out the application for the tax thing, so the stimulus. So a lot of people who are either farmers or unemployed, people they've actually, or didn't file, they've been picking up these forms from us. And so, they honk the horn, and we know because they called already. We know who they are. We run the form out to them, and then they leave. And they ask for an extra copy because what they do is, they have to drop one and keep one. So we've seen an increase in that, but most especially the increase on people applying for public assistance through public health, Catholic Social Services, Salvation Army.
Mayor, are you seeing, because I was getting some comments on this last night and even on our stream, are you seeing that there are people who haven't been working, but for whatever reason don't meet that criteria for public assistance? Because what I'm hearing is there's a lot of people who need help, but just don't qualify for that. But that doesn't mean they're, Donald Trumping or they're balling,
Right. Well, the ones that, that have called us that they don't qualify for food stamp because, they're looking at the, they have assets.
Right.
They have assets, and probably those are some of the reasons why they don't qualify, because part of it is you sell your assets, and of course people are not going to do that.
Right.
And so what they're doing is they're at least applying for food supplements through CSS and Salvation Army. And so, we're asking, we have some toiletries that were donated to our office, and so we asked, do you need toiletries? Do you need, hygiene stuff? Because we have that. Right. And we don't have a store, but, we have things, a tube here and a couple of bars of soap here and shampoo. So we're giving those out to residents who actually have expressed their concerns with us.
Right. But maybe
so they'll drive up and we'll have a bag up front.
Right. That's very good. Very good. You see the grab-and-go meals, what is that like when, I got a message yesterday that, people line up early to get these meals because, for a lot of them, it's the only way they're going to eat?
Well, when you have children at home, and it's not just for school-age children, it's 0 to 18, and you don't have to be a public school student. So, we see more families taking advantage of it. The good thing is that people in line are able to get, because unlike the beginning of the grab-and-go meal, people were leaving with 15, 20 boxes of meals. Now the per car is limited to 10, so that everybody in the line can get something. So, I think it's going well. Families are getting their meals, children are eating, and on several occasions when they've had leftovers, they've called us and said, what can you help us distribute this? And
right.
We've taken it to Pacific Gardens and Titano Apartments along Machechi Avenue. We've taken it to the middle of Nevermind Road and Swamp Road.
Wow, Mayor. So when you go into these areas with these meals, what's the response? Because I'm getting the visual in my head. It's like kind of an ice cream truck.
Well, kind of an ice cream truck is correct.
Right.
Because what we do is my guys would turn on their siren. I would honk my horn and I'll just drive through. I said, do you have kids in there? And, and then they run just to the edge of their property. and I'll get out and we'll just give it to them.
Wow.
How many kids you have to give six, you know? But, I mean, and that's only very limited to very few times that they actually have leftovers.
Right,
because most of the time, it's actually, everything is taken by the end of the day.
Right.
But very rare where, you don't, there's days when sometimes, very rare. I think only maybe 3-4 times that this has happened since the beginning.
Yeah.
Yeah.
Well, Mayor, we've had your colleagues and you call for transparency, and I think that they should have some kind of briefing. I know we're doing the community testing where they bring you guys in and just like, hey, mayors, what are the problems in your village? And you tell them things like, man, people are hungry, they're lining up, they need assistance, because I don't know if they get it or they hear it or they know it. I just think that that's got to be a big part of the conversation, especially if we're told to hang in there and there's nothing left to hang on to.
I hear you. Yeah. But, if anyone has questions, they can call their mayor's offices, and, we'll try to answer to the best. But 311 is a number I tell people to call. Mm-hmm. Also, I can't answer stimulus and tax questions. I can't, so.
We know. We know.
Yeah. Hey, thank you, Mayor.
Thanks, Mayor. I hope everything goes well this Saturday.
Sorry about blowing up your phone all day yesterday.
It's okay. I just can't answer questions.
I know. I got you.
Yeah, okay.
Thank you, though,
all right,
Mayor.
You take
Appreciate
care.
it.
You too.
Okay. Wash your hands.
Okay, that was Dededo Mayor Melissa Zavares giving us some information about the community pilot testing program that's happening Saturday at the Estumbo Gym. This is specifically for residents that live around the gym, the Sagan Linadzan area. About 80 homes there. We're talking about 400 to 500 people.
Right.
They're not saying that all 400 to 500 people are going to get tested. What they're specifically looking for are people who have certain symptoms, the cold and flu-like symptoms,
or comorbidities or chronic illness. I think we've got a list, but we're going to go and get that for you guys.
Mild symptoms.
Right. 703. And then it was also interesting what the mayor had said about this testing being for the immediate Estumbo area.
Yeah, right. Yeah. And so everybody else in the community, no matter where you live, if you are feeling sick, you can call your own clinic. You can go to the Northern Regional Medical Center, the Central and Southern, because that's what they want. They want you to get tested.
And then, I want to qualify what Bree said with if you're feeling sick, if you have any of the COVID symptoms, some of which include loss of taste or sense of smell. Mm-hmm. So you might not have the sore throat, the runny nose, but you might have the loss of taste or sense of smell, and then that would put you in that criteria to get tested. So we've been staying home, guys. Again, I want to thank the people of Guam because I really feel like without the curfew, without the the real checkpoints, without the $5,000 ticket, we were able to do our part and stay home. And now Gov Guam, it's up to them to kind of get on their level and test these people. But it's also on you guys. We got to, they can't force you to get tested. It's free, no insurance, no problem. So let's get out there and get tested again. Not just Estumbo. People are wondering, don't wait for the community testing to go to your village.
Yeah,
go to the clinic. Mm-hmm. You've got a Northern Clinic in Dedido, Southern Clinic in Narahan.
And then Central in Barragata.
Right. And so you don't need insurance to go and get this test. So please go get tested, guys, because I know we miss life, right? We all miss life. But we're not going to, reopen the island in baby steps if we don't get tested and find out where we're at. Who knows? We could get everybody tested and find out we've got so many cases, and that just changes everything.
Or we don't have so many cases. Yeah. So please, if you can get tested, for those of you who aren't feeling sick, you really should still stay home and practice all the social distancing measures, because we're not by no means out of the woods yet.
Right. And so it is the 23rd day of April. It's Thursday. We're KUAM-FM, Hagatna, Guam. It's the KUAM News takeover of containing COVID. And 7:05 now. Just kind of want to take a little moment here to do a very special dedication to a very special person on her very special day. I just want to say happy birthday to Sabrina Salas-Mantanani.
Thank you.
All right. So happy birthday, Bree. I'm sorry you got a bum deal birthday during the COVID-19 lockdown.
It's not a bum deal.
But Jay, you want to join in? Let's sing happy birthday to Sabrina. Guys,
Aw.
Facebook Live, if you guys are
You
watching.
really don't have
wait.
It's okay.
Okay, so you've got like a very extensive background in music and production and everything like that.
Wow, Jay.
Are you going to take the high part, because we are doing our first
Where's the guitar?
We are doing
I wanna
our
see the guitar.
acapella birthday greeting
It's a little early for the high part, Jay.
behind masks.
Yeah, okay, ready?
Okay.
Okay.
Happy birthday to you. Happy birthday to you. Join on in comments, everybody.
Happy birthday, dear Sabrina. Happy birthday to you. May the dear Lord bless you.
The fast part.
May the dear Lord bless you. May the dear Lord bless Sabrina.
Big finish.
Happy birthday to you.
Thank you, guys.
How does it feel to be 24?
Forever 24? Forever 24? Feels good. Even though my brother, he's here on Facebook, he's like, she's getting old. Thanks, Pat.
Yeah, family's always the best. Hey, 707, we're going to take a break. Coming up, we've got, I want to talk to a local businessman, get his take on reopening the island. And, remember, like Dr. Cabrera said, discussions, not decisions. So we are having that conversation at the highest levels of the government of Guam. So we'll find out, we get some 2 cents from the private sector. That's next on Containing COVID. Good morning.
Keeping you informed, KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the People's Bank.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafaday Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Chris and Christy Cruz. Open Naguinaidza. 7-Eleven, Guam's favorite on the Sabrina Sauce Matanani birthday show. Containing COVID. 7-Eleven, we had Mayor Zavares on the line a little bit ago, and she's talking about reaching out into the community in Estumbo, and we know that there is a large FSM group there, and we wanted to bring in Johnny from the FSM Consulate's office. He is a foreign service officer.
Right.
Johnny,
Hi, Johnny.
Johnny, good morning, Johnny.
Good morning. Good morning. You're so early. Happy birthday, Sabrina.
Oh, thanks, Johnny.
Yeah.
So nice.
Yeah, so thank you for having me.
Right. We wanted to bring you on to kind of get the message out there that the new thing that we're trying to do is to get tested. So, want to reach out to all of our brothers and sisters in the FSM community and make that ask, Johnny. There's they can get tested at the Southern Public Health Center in Inarajan, the northern one in Dedido, and also for the Estumbo area at the Estumbo pilot program, community testing on Saturday. Are you getting that message out there, John?
Not really, Chris. I was just finding out yesterday, so I'm thinking maybe we should be reaching out to governor's office or even to the mayor's offices to see if we can get the pamphlet or at least the information, the sheet, so we can put on our Facebook page, our FSM Association Facebook page.
Right.
And I'm also thinking maybe the Micronesian Resource Center, they might also have it, or if not, I think it will be good to also reach out to that 311 to maybe see if they can just relate directly to us so we can put it out there.
Mm-hmm.
Right.
So what they're looking for, Johnny, is people that have mild symptoms, cold or a cough or a shortness of, loss of taste.
Sense of smell.
Right.
Any chronic disease like, diabetes, hypertension.
People that aren't feeling
cancer.
well. Right. They want them to come in and get tested. And again, it could be at any of the public health centers. They've changed their game plan in terms of how they're going to attack COVID-19 and trying to determine how prevalent it is out in the community. So they're asking everybody to please help spread the word, if you can, to the FSM communities. That,
not a problem. Not a problem. I think that's one thing that we would love to, give out to our, relay the information out to our citizens. But you're saying this is generally to, like, any chronic disease that any individual may have?
Yeah. So
right. It's anybody. It's not just the FS. It's everybody. But
right. But, and going out there and reaching out to the Estumbo community, Mayor Zavares said that they've enlisted the help of some Chuukese interpreters to kind of go house to house and talk about the testing and what we're trying to do with it. And there's also a flyer. I don't know if they got it translated, but you're right. That's something they need to, something they should have done, quite frankly, a couple of days ago. Reach out to you guys, shoot everything to you, have you translate it, and then, let's use this vast network that you guys have.
I think the translation may not be that an issue.
Okay.
But I think it's just trying to get the word out. I think it would be better if sooner, so at least we can get a lot of a good number out there.
Right, Johnny. So we want to give you the floor. We have a lot of FSM followers on our Facebook. A lot of people watching the stream. A lot of people listening out there. So we just want to give you the floor, give a message out to the FSM community about getting tested, Johnny. Here you go.
Okay, thank you, Chris. To our FSM citizens, on behalf of our Consul General and our FSM Association, the President, and all the members, I wish to ask that, our citizens here on Guam go out there, see the information out there, and please, if we can all be good citizens and do our part to be tested for this COVID-19. We hope that we will all come out of this sooner than later. So please join the rest of the community to do our part. Thank you.
Can you also say it in your native language?
You know, I wish I can say it in all our languages, but for Pohnpeian, I will say this. Imen pachawan wulianti sa machail kousan takchail men Pohnpeikan me kachkas tapach pachanan wen kuam chalen kachin sabulman kiyan sumao kachla wasan kosoukan me pain sainsal no weekend makachin kupura boyaki an sukset second chanon sainsal ya utan wasakan me pan tes wiya sainsal no weekend what me pan what the me pan what the torch me tes pan wiya ipachuan peki wulianti at lopis o peki ikarakara pang puran karusian chalen kachin kupur mangay kachilan wasan teskan kachail pan kachin masani pene yat makmail pilkin yang tatong ke Facebook mail kak kachin masani nan sin machail FSM Association page FSM the Facebook o where pene utania wasak ngayakan mateswat pawiyawi o klok kalanganan kupuran koros
Castellet.
Yeah, good. Thank you. I really hope that we'll get all or at least a good number for our citizens to be tested.
We also reached out to Ed from Manette Louis. He's going to come on the show tomorrow morning and also put out a message. We're just trying to mobilize all of our listeners, our audience, our platform. We have new orders. Let's go get tested.
That's really good. Yes.
Thank you, Johnny. Appreciate
Thanks, Johnny.
it. Yeah.
All right. Yeah. Enjoy the rest of your day.
You too. Yeah, you too. And you stay in touch. Shoot us a text, okay, Johnny?
Okay, sure.
All right.
Thanks, Johnny.
Wash your hands. Okay, 718, Guam's favorite. Do you want to go over those numbers? I'm going to get somebody on the phone, maybe just some of the results from last night.
Okay, so Public Health, they ran, I believe it was 34 tests yesterday. 0 tested positive, but they did have one additional case that tested positive, and that was through the U.S. Naval Hospital, Guam. So the total number of confirmed cases of COVID-19 on Guam is 137 with 5 deaths and 119 recoveries. And again, I know people ask about, recoveries, but that means that a patient is no longer considered infectious. According to the U.S. CDC guidelines, a patient is classified as recovered after at least 72 hours have passed without a fever or additional respiratory issues, and at least 7 days have passed since symptoms first appeared. And all the remaining cases are in isolation. Again, 137 confirmed cases of COVID-19 on Guam.
All right, let's keep it moving on the phones. 720. Wanted to bring Mike Israel, local businessman, on to talk about his idea reopening the economy. Good morning, Mike.
Hi, Chris. Darn, I thought you were going to call and try and punk me and put me on like a malfunction moment.
I could. We could just start all over if you want.
Yeah, that would be a lot of fun, I mean, it's just like clueless person you call. Yeah, happier times. This is nuts. Let's go back in time a little bit, okay? If somebody sells you a car and says it's 500 horsepower and you drive it down the road and it can barely go 5 miles an hour, do you keep driving it praying that eventually you'll get to 500? Or do you bring it back to the dealer, shove it up his rear end and tell him, you're a fraud, you're wrong? Why are we not doing that in this case? 6 weeks, 8 weeks ago, a bunch of guys showed up in the governor's office and scared the hell out of the governor, telling the governor, 22,000 are going to be dead in a matter of weeks, and that if you don't immediately respond, we can get it down to, maybe 2,000 or 6,000. I mean, the numbers are crazy. They even have charts out there where they're showing hospitalizations through the roof, okay? Right now, according to their chart, that they just produced only April 3rd. They were talking 20 days ago. So it was accurate to 20 days ago, right? And then from April 3rd, it just has a skyrocketing number going through the roof. All right? So on April 3rd, you know how many COVID cases we had in the hospital? 25. Do you know how many COVID cases we had like last week? 5. You know how many cases we had like a couple days ago? 2. And as I understand it, we have like 1 right now in the hospital and none in ICU. Yet the governor's out there getting ready to build a 150 or 600 room hospital in the freaking ballroom of the Sheraton. Come on, guys. If these charlatans who told us we're going to have 20,000 deaths 6 or 8 weeks ago, they're so far off, why are we still listening to them? And killing our economy with a, 60% unemployment? Over what? Something that has emptied our GMH, filled the GRMC nicely, but empty GMH? Why is nobody asking her, hey, Governor, 6 weeks ago these guys were totally wrong, ruined our economy. Why are you still listening to her?
Well, tell us how you really feel.
Yeah, I mean, don't beat around the bush, man.
Hey, listen,
Give it to us straight.
I'm old. I'm entering dementia state. You know, I've inherited my dad's lack of filter. So come on, guys, let's stand up and start talking, have a conversation. Where are these experts, and why have their models been so wrong? And yet, the impact they've had are so real.
That's definitely a good point, Mike. And I think
mean, you guys we're talking to, you're all employed. And GovGuam workers, God bless them, they're employed. That's the 40% working right now. But the 60%, the ones who bring money to Guam, we're flat on our backs. Do they seriously think that we can have a Guam economy without tourism? Crickets.
Yeah.
I mean, nothing, right? I mean, tell me they didn't scare the governor with 20,000 deaths, 22,000 deaths, just a couple months ago.
Right.
Where are all these dead? The 5 dead? I mean, every death is a tragedy. But those 5, they had all totally underlying conditions. Any common flu would have knocked most of them over anyway. Why are we killing our economy? Why are we putting everybody unemployed? And if you think you can reopen Guam without tourism, where's the money coming in? Because I know where the money goes out. It goes out for oil to pay for the energy. It goes out for all the food we import because we sure as heck don't grow it anymore. The island has a sucking sound going on right now. We are whistling past our graveyard.
Yeah, I'm curious
Why do you think?
I hear lots of crickets.
Yeah, no, I mean, the governor had come out yesterday and said that, the reason why that first trajectory was so alarming and was kind of doomsday.
She did such a great job. That's what tamped it down. Oh, come on.
Well,
We're all seeing each other. We're spreading it around. It's a nothing burger.
I mean, yeah, some people feel that way.
Mm-hmm.
Anybody who's thought about it knows it's that way. There's only a handful of people, they all reside at the governor's office, who think that we're on the verge of total meltdown and everybody's going to die. We're going to die all right. We're going to die of starvation when we don't have any money to pay for the food. What's going to happen next few months? You're going to see the island population drop because people cannot sit around here and try to live on government handouts because it just doesn't work. Where do you think the government got the money from? We're going to have the great sucking sound. First, it's going to be the money, then it's going to be the people.
Mm-hmm.
Mike, has anyone approached you about being a part of this economic recovery?
Well, definitely not after today, but yeah. Have you been in any kind of conversations? I know GVB has a task force,
right?
But have you been in any sort of dialogue?
Did anybody ask you, hey, what do you guys think?
Absolutely not. The thing is, there's certain styles of leadership. One style of leadership, which I like to think I'm part of, is that when I form a task force, I want it with people who are my biggest critics because they're going to bring in the points I might be missing.
Right.
There are others who have a leadership style more along the line of, if I don't like what you're saying, I shut you off. So those task force are totally worthless because they're scared. Yeah, I talked to members of it. They all agree. I mean, you can't deny what I'm saying. Nobody's got on the air. I mean, come on, Dr. Cabrera, Dr. Cruz, the other villain in this case, Than Hancock. Yeah, running around, I'm from the CDC, using up these fake models produced by the Bill Gates group that have been scaring America. Remember America? We're supposed to have 22 million dead. No, what was it? 2.2 million dead. Now we're down to 47,000 dead, which is a bad number. But that's only because they're faking the data now. They're so desperate, they're looking for problems now because none of their models have come out. They're reclassifying people who would have died, expired from other causes, reclassifying them all into COVID, desperately trying to get to the 60,000, which they're even struggling to get to. Their models are frauds. Their models are fake. They're all based on wrong assumptions. I used to when I was in high school, I used to computer program. Garbage in, garbage out. It all depends on what I love these models. I've seen them. I've gone to the website. They'll predict to the half death how many people in your community are going to die. Mm-hmm. Seriously? What are they based on? And I know the math. I know how the math works. I know what exponential growth is. But that's not how humans work. Sure, I could go out and infect someone in 13 people in one day. But guess what? I see the same people every day. I don't go out and meet a new set of 13 people every single day. That's what the model's based on. And all those people I infected, they will also go out and find 13 unique people that they have not met before. And then it's impossible. According to the regression model, the entire island should have been infected within a few days. Now, by the way, I do believe this infection is a very, very contagious infection. And if you have a good, strong, healthy immune system, you have absolutely no worries. Every single one of the deaths, almost all of them, minor part, they haven't been able to find a comorbidity, but all of them have comorbidity. That means they had other issues. You notice in Guam, we're never going to see another lung cancer case again because you're going to die of COVID, not lung cancer. The fact that you smoked 4 packs a day for the last 60 years, we're going to forget about that. You caught the flu the last couple of days of your life, and now we're going to classify you as a COVID death. This is getting crazy. Fauci and those guys, they blew it. Just admit it. Walk away. Let us recover. We're going to carry a heavy burden, as it is. If we reopen today, we still are going to carry a heavy financial burden for at least another generation. Mm-hmm. Hawaii, the state of Hawaii, you know what they did, right? Hello?
Go ahead, yeah.
State of Hawaii. Liberal, Democrat, just as extreme as our governor. She herself knows they're in big trouble. They have slashed all government wages by 20%.
Yeah.
Why? Because she knows there's no money. She's not relying on the federal government to show up. And believe me, she's got a better case than we do. She's a state. We don't even pay into the federal government. And wait, the governor's writing checks that we can't even begin to afford, even if we open up now. So we've got to get open, and it's still going to have a heavy economic burden we're going to carry. You have to pay for your mistakes. We made a giant mistake 8 weeks ago. Let's stop it now.
If you were on the governor's economic recovery panel of advisors, what advice would you give her?
Okay, we're already paying for the GovGuam workers. Let's have them open today. Okay? Let's see how many people fill the hospital with bad cases of COVID. We've got 250 beds and more sitting around empty. The whole point of the slowdown, because, see, no one really believes you can stop it. It's impossible, okay? But the whole point of the flattening of the curve was to fit the number of cases to the capacity that you have. They call it peak capacity. The United States passed it a couple weeks ago. We are thinking we're going to hit it out in September and October of this year. We're the only people thinking like that. The reason why September and October is hysterical, that's when the flu season for the next year starts. In Guam, we don't have a flu season because we're hot all year round. See what I mean? We're using numbers and statistics from places that don't apply to Guam. A lot of the numbers she's using today were the very first numbers when we had a hot spot in Italy. And if everybody in Guam was over the age of 80 and we lived in freezing homes with poor heat and with no care available because they have socialized medicine. I mean, if you get sick there, you're on your own. There is no medical system in Italy. Yeah, okay, maybe we might see the numbers that they're reporting, but we're not 80 years old. We're not living in a freezing country, and we have a place with 3 hospitals for 170,000 people. So, I would open up one group of people, Guam. Okay, let's start with them first because we're paying for them anyway. There's no economic cost to opening up there. Let's see if we start filling up hospital beds. Then we should stop. We're a very small island. I want to say country. I mean, but at the rate we're going, we're always going to be subservient to Big Uncle because we can't seem to support ourselves economically. But let's call ourselves an island. We're a small island. We're very nimble. We can turn it on, turn it off real fast. And so we start filling up the GovGuam offices. People would start filing taxes or whatever, getting health certificates. I can't even open my restaurants because my health certificates are expiring. And my employees can't go and get a health certificate because nobody's open. Doesn't matter. They don't have a job now anyway. And so that's a big issue. Let's see what happens. The next day, okay, let's open up some of the local businesses. That's next week. Remember, this is a very, very, very fast-moving contagion. If there is really a problem, we're going to see it right away, and then we can close right away.
But they haven't had the ability to do the mass testing, so they're not unable to determine just how widespread COVID is on Guam.
All right, there's a couple things we got to keep in mind. First off, the current existing test, and the governor is absolutely not using what we can get easily, but waiting for the unicorn of tests to come. That was silly. But we have what we have. At best, the test is only good if you have active corona at that moment they test you. Okay? So that means that maybe as you walked up to the test station and someone coughed on you with corona, you have it, but you don't have enough in you for it to be detected. Or you have corona, but your body system has beat it down so much that again tests negative. The false negatives on the test are through the roof. Because remember, the test, you need to have so much active COVID in your body to test. Okay? So the test is pretty much worthless. But a lot of people want to test. God bless them. Test all you want. Testing doesn't end you in the hospital. Believe me, when you feel bad enough, then that's when we have to intervene. Feed you some of the Trump pills. We have now that's another thing that's changed in the last 8 weeks. We now have things that we can do. Before we had COVID, I was like, oh, well, go home, take a Tylenol, drink lots of fluids. That's what I did when I caught it back in January. Oh, yeah, right. Guam had COVID ever since January, possibly December. Remember, we're in Asia, okay? It took a while to hit America because it had to go through Europe and then jump into America. Us, we're directly, Korea and Japan, lots of contacts with Japan. They got it first. And believe me, we got it first also. We had COVID, we didn't even know it. Come on, how many, and you're telling me malfunction and that you didn't get ill, you didn't get kind of like bad flu between January and March?
Nope.
I did.
I take my vitamins.
I did. My son did.
Yeah. Yeah, no, and yeah, exactly. I came back from a trip early January, walked into my office. I looked at my manager. I said, wow, man, you look like hell. He goes, yeah, there's this flu that's cutting through the office really fast. And sure enough, the next night, I said, honey, I feel a little little sniffles in the nose and the dry cough. My bones ache. That was the one. My bones ache, So I crawled into bed, drank lots of juice. She fed me tons of vitamin C and multivitamin pills, and I rested, let my body build its immune system and clobber it. Right. That's how you solve it. You solve it by getting people infected so they develop an immune system. We cannot live in a bubble the rest of our life. Okay. And that's what they think we're going to do. We're going to live in this bubble. We're going to protect ourselves. I mean, the Theodore Roosevelt, the other day I read they after they quarantined these guys for 14 days, after they tested negative, 3-4 weeks later, they're all coming out positive. It's a wild virus. It's in the wild. I mean, we're just delusional. And so the real question is not whether you have COVID or not. The question is whether we have so many cases that are bad, it overwhelms our ability to deal with them. Right now, we have a 250-room hospital, so less than 250, but that combined with the SMU, sitting empty. We have the military who's committed to us that, hey, you guys get in trouble, don't worry, we've got capacities on our side as well. Now's the time to be doing it while those capacities are still here. They've got like a ton of military personnel sitting on base. Now's the time we need to test, basically. The real test is get out and mingle, and let's see how many get sick. If it starts to grow, that's why we do it gradually. We start with Guam first. Then we start with all businesses on Guam except, say, restaurants and other places of congregation, such as theaters, movie theaters and stuff. Again, wait a week, wait 10 days if you want. And then you go to the last phase, totally open. Because remember, even after we're open, we're still not going to have business for a while because we need to prove to Korea and Japan that we've got our COVID situation under control. Because they also have quarantine as well.
Okay, Mike, you know, we actually have Dr. Cabrera calling in, so we want to kind of run some of the points that you brought up. So I appreciate it. Definitely a lot of...
Thanks for that perspective.
But no, before Dr. Cabrera talks, I'd like to make one statement.
Sure.
I apologize to Dr. Cabrera. I had received some wrong information, or I misunderstood the information receiving. I referred to him not as not a real doctor. He, in fact, is a very eminent doctor, Yale and other school graduate. In fact, he's even board certified in the area that he is practicing internal medicine. I apologize for that misstatement the other day on the another radio show.
Okay.
Okay.
Got it. Thanks, Mike. Hey, yeah, call it anytime, man.
Oh, okay. So hang up there.
Yeah.
All right.
Thank you.
And let us know if you get a call from the governor's economic recovery thing.
No, that's never going to happen. All right. Thank you.
Okay, bye.
All right, bye.
You know, I'll give her his number. Let's just keep going here, Dr. Cabrera. Let's bring you on here. I guess just first of all, what would you make of Mike Israel's comments? Let's get that, and then we'll get into what we were really going to talk about.
Hi. First of all, happy birthday, Sabrina.
Oh, thank you.
You know, it's a great day to celebrate. You know, and we really need to take the time to appreciate all the things that we can, and you know, we want to celebrate you today. So thank you so much for everything you've done for Guam and for the message and the advocacy that you've done for everyone. And you are truly a lifesaver, and we appreciate you.
Oh, thank you.
Wow,
appreciate
Doc.
that. Wow.
Wow. Jeez, I didn't even go that far.
It's not your birthday yet, Chris.
Now I got to, though. I got to write Brie a letter.
He's going to be tomorrow's my birthday.
Yeah, Doc, so I guess just first of all, if you want to comment on what Mike was saying.
Well, sorry, I was listening in and out there because I was moving. You know, I think he's, you know, definitely entitled to his opinion on the matter. You know, what you're seeing here is, you know, you're seeing a large variety of opinions, and mainly that's because this is not easy. That this is very difficult, difficult to handle. This is unprecedented. But you know, what we have to remember that the advantage we had here in Guam, which is that we had a crystal ball in looking into the future, and that future was Italy. That future was New York, and we knew that how dangerous this virus was, and we had an opportunity to do so much to not become those cities, and so that was important, and that's something that we have to really focus on. And actually, and right now, what we're seeing here is that we've actually so far have done a good enough job to at least prevent that from happening, and we want to take the time to understand really what impact our actions have now, because we were basically doing what we can to follow other countries that have so far been successful. We're not doing anything that unique, really. We followed examples and different recommendations, and so far it's proven to work. And I think the thing that was the most effective was our early actions.
Right. And then that being the social distancing and implementing, right, shutting down the government, right?
Yeah. And so, you know, in terms of, you know, the numbers and the projections, I get it. You know, I get it. It was scary. It was scary for us. We couldn't sleep. I felt sick to my stomach. I couldn't eat, you know, after the first view of those numbers. And you know, the governor has put people, you know, in terms of us advising her, who was going to lay it straight and not necessarily sugarcoat anything. And we did that. And again, these trajectories were not forecasts of our fate. They were a projection of possibilities, not saying that it was going to happen. And so people to say that, it's this date, and they said that we were supposed to have this many on this date. That was, those were projections from 3, weeks ago or so, and that we're looking at a possibility of that happening. It hasn't happened, and it's because of our actions early. It's not like a typhoon forecast where our actions change the course of the typhoon. It doesn't. But in this case, with this disease and with how contagious and rapidly spreading it is, our actions actually change the course of it. And that's a unique advantage that we have with these projections, and we took advantage of it. And because of that, we're seeing the benefits of it.
Yeah, Doc. I mean, people. Do you take it personally when people kind of say like, "Oh, Dr. Doomsday went out and said, oh, doom and gloom"? Because I can definitely see that you guys made this trajectory. The first one, with little data, like the governor said, but you stand by that trajectory as the right call for that time.
Oh, absolutely, 100%, stand by it, and I'll take that to the grave. And the key thing in that is that we did not do this alone. We did this in conjunction with the U.S. Army Corps of Engineers. Mm-hmm. We did this with the CDC. We did this with Johns Hopkins Applied Physics Lab. We did this with UPenn School of Medicine's CHIME calculator. We did this with a lot of very prominent collaborating entities here.
Are we talking about the first projections, or are we talking about the?
Oh, just overall.
Overall, okay.
In the first projections, it was the U.S. Army Corps of Engineers, and with some input from the CDC as well, and then also with other publications that have been around. So we didn't just make up these numbers, and we didn't just plug in things, like randomly, like the comment, garbage in, garbage out. It's the best that we had at the time, and we had to make and like I say, it was pitch black, and we needed a flint of light to at least have a view of what might be we facing. How big could this monster actually be? Mm-hmm. And because we saw what it was, we were able to act accordingly. There's this really great publication by Tomas Manglanya. And he is a brilliant writer. He's put a lot together in terms of the coronavirus and different parts of the multi-article publication. But, he talks about the hammer and the dance. Mm-hmm. And he talks about the hammer having to come early and then the dance afterwards. We in a sense, we placed the hammer down, over these past several weeks. And what he wrote was that it had to go on for about 3 to 7 weeks in most areas. Right now we're entering the dance phase, and so this is the search and destroy phase where we have to now find where the coronavirus may be hiding, because anywhere it's hiding, even one person can spread it rapidly, and so we have to be sure that we identify them and be able to contain it and control it. So that, again, what's the primary goal in what we're doing? Why are we doing all of this? Mm-hmm. You have to remember, it's not because we're worried about 100% of the people that catch coronavirus are going to get deadly ill. No, it's because of that small percentage that's gonna get very ill very quickly and overwhelm the hospital system and then increase the mortality rate. That's the primary goal, and we have to focus on that. So to use these anecdotal messages about, we got sick throughout the office and we're all fine. Yeah, because that's what the virus does, and it makes you fine. And if it killed off everybody, it wouldn't be an effective virus. It wouldn't spread. It'll kill off its host way too quickly. But it's just the right amount of enough people that can go by and not get tremendously ill from it. And right now, what we're finding is that even more and more so than we suspected is that there are many asymptomatic spreaders.
Right. Yeah.
And so if you're young and healthy and you have a good immune system, great. You're probably not going to feel sick, but guess what? You probably can still spread the virus without knowing it.
Mm-hmm.
Doc, just real quick, just going back to what Mike was saying, how responsible would it be to just open the government of Guam today?
Well, what do you think, Chris? I think I think it's very clear what my answer would be, but I like to hear what you think that might.
I think it's a little crazy. But I mean, we are having those conversations, right, Doc? I mean, you can't really fault people for looking at that recovery, because that's the conversation that we're starting to have now. The governor has said, she's been very clear, and I'll go back to the press conference yesterday. She said, hey, we have 14 days of 0 to minimal cases, and I'm not sure what minimal would be, and then we do all these other things. We do the mass testing. If that looks good, then, I mean, she basically said, yeah, we're going to start to reopen the island. That doesn't mean they're just going to open up the gates and, tear down the checkpoints and everybody go do with, everything. And I'm sure it's going to be incrementally in some sort of baby steps. Right. But so how do we continue to take it? Like, because I'm on board. I'm taking it serious. I realize, like you said, 80% of the people who get this virus are going to be fine. But we're a very vulnerable community with the chronic disease, with the comorbidity. So I get it, Doc. I get it. We're doing our part. We've always been the ones messaging, stay home, stay home, stay home. Now the message is get tested. So I get it, but people are thinking about reopening the island now because we're talking about it.
Look, I'm going to be the first to admit I'm not a business professional. I don't have that's not my expertise. I don't understand the economy anywhere as close to as many other very smart people on this island. But the reality is that you can't have an economy with very sick people and a lot of dead people. And so the understanding in this is that we are taking a very gradual approach. We're using guidelines. We actually think that the guidelines set out by the task force from the White House is extremely well written, and it's very good. And what we're doing right now is we're using that to adapt to one that's specific to Guam, using a lot of those guidelines. Ricky Hernandez is here from GITA is doing a great job in drafting that up. And we're reviewing it. It's heavy on the medical recommendations as well. There's different things that we got to check mark. We went over some of that yesterday in the press conference. And these are things that we're not just making these things up ourselves. They are based on very well thought of guidelines, and we want to do our best to follow it, because that's the light on the path that we have to follow.
So basically, decisions that are going to be made on the reopening of Guam will be based on the findings of this mass community testing that you guys are going to launch.
It's not. That's only a tiny part of it. What this is. What this community testing, again, is targeted toward, some of the population that, again, probably have poor access to care. Mm-hmm. And so, it's us shining the light on other parts of that may not be on the path that we are right now.
Right, but it's also this, because you guys are in this new phase, you're also making sure that people know that you can also go to any of the clinics and get tested, or a private clinic and get tested. Right. So based on the data that you receive, how you're only saying that's going to be a little bit of a portion of the decisions that are going to be made?
Sorry, I thought specific to what's going on this Saturday. That's what I. Yeah,
no, I just meant testing in general.
Testing in general, yes, that's going to be a big part of it, and so that, because we don't have a true, real confidence in our sense of what the actual prevalence on the island is.
Right.
GMH has another COVID positive admission. Okay. And so
when was this, Doc?
As my knowledge, is as early as yesterday.
Okay.
Just one?
One new one.
Okay.
Yeah. So there's 2 right now as of this morning that are admitted. One was discharged. There was 2 yesterday. One was discharged, and then there's a new one admitted, and so there's 2 this morning as of the report I got.
Okay.
And so to think that this is completely done is this is one very small example that it's not, that there are still active cases. God bless Naval Hospital, because their number of cases admissions are still rising. That's a whole different entity, and that's a different process.
What do you know about that though, Doc? Because we don't. I don't know if we get that info from Naval Hospital, but are you aware of how many hospitalizations, COVID hospitalizations, are at the Naval Hospital?
I don't know what it is today. And the basic numbers is that we, with the number of positive tests rising, I think they're seeing a proportionate rise in their admissions as well. Okay. I have no idea about how sick they are. I have no idea about how many in the ICU or what have you. Mm-hmm. But what it looks like is that it's following following the what would be a expected proportion. Now they're a much healthier overall population, so it's a much smaller percentage of those who are infected that actually end up being hospitalized, and so thank God for that. But it's something that it's still a very real threat here on the island, and if we peel things back too quickly, then we're starting to know enough about what this virus is, that of how quickly it can spring up on us. And we have to remember, this is an exponential growth and threat that we had, and because of that, especially 3-4 weeks ago, we were talking about overwhelming the system within 5 days, and if people didn't act and take this seriously, and thank God people did, thank God, because it was a real disaster that was facing us, and because and this is a great credit to all of Guam and to the leadership on Guam as well. And I'm not just talking about government leadership, I'm talking about leadership in the community, leadership in business, who really took this seriously, took the right steps, even to protect their businesses that were considered essential.
Real quickly,
Sorry,
Dr. Cabrera, because we're running up against the time, I did want to ask this because we didn't have the opportunity to ask it during the press conference yesterday, because we're only limited to 2 questions and then we get muted.
Right.
So I wanted to ask, there's this article on CNN and other publications that the maker of the Abbott ID Now device, which I believe are the 2 that we have on island, they're saying that it can produce false negatives if a special solution is used to move or store patient samples. And that solution is a viral transport media.
VTM. And so we had heard from Dr. Hoa yesterday that we are using the VTM and that we're actually short of it. So I guess our question to you is this report, these national media reports about the test that is distributed by the federal government, and then again the warning that it can produce false negatives if a special solution is used to move or store the samples, does that have any effect on the testing we've been doing and the large number of negative results we've been getting?
So here's the this is actually this issue that might actually be a blessing in disguise, and the reason being is because to have the right supplies and amount of the viral transport medium is a struggle, and that's a rate limiting step in our ability to do the test. The fact that we can use a simple swab and put it in saline and then take it and it getting run, that's the simplest way to run the test, and what it's actually showing is that's the most accurate way to run the test, and so that's an advantage that we have. Now the test can only run one at a time, so that's a different issue. So there's a backlog, then we have to account for that. But otherwise, that's why it was very important that we have multiple modalities to run tests, because if there's limitations in one, we can switch to another. So that's a key part here. And so with the if we can't run it on the Abbott ID Now, then they go on the ABI 7500 or the BD Max, for example, and those need the biotransport medium for them, and they're more accurate or just as accurate with the biotransport medium.
So how many tests have we run with the Abbott using the VTM?
I don't know that number yet. But I'll tell you this, that any of the high suspicion or any time that there's a reasonable suspicion, they were being rerun on the ABI 7500.
So are you saying, Doc, that even with these national reports about the validity of the tests that we're using, that you still stand by every test that we've run with samples put in that VTM on that Abbott ID machine? You stand by those results?
Absolutely not, and because that's the nature of the test, that it's never going to be 100%, so I don't stand by that, because we know that by nature we can't, because every test has a degree of false positive and false negative results. Now 85% positive, meaning a 15% potential false negative when you use the VTM, that is quite high, and that is quite concerning. And so we're gonna, everything in this whole process is understand and then pivot, right. And so we're going to continue to do that. And the more that we try and stay on top of as much of this, and we try and take that into account, and then we try and pivot when it really makes sense to do so, without hopefully not hurting ourselves in that same pivot.
So that's something that I guess you guys are going to be backtracking and looking at.
Oh yeah, absolutely, and that's something that I'm. That the lab has already been doing and been looking at really closely. the clinicians, as in the doctors and the providers, have all been looking at this very closely. It goes to the fact that these tests are not perfect, but that's why we still need to be very vigilant in how we test and in who we test, and ensure that we understand that we don't just do mass testing, because mass testing is when you can get more of the danger out of it, and that having good profiles and understanding who we're testing is going to be very key to understanding if there's a problem that pops up in terms of the testing results.
Doc, I'm just curious, devil's advocate or just advocate again, if we have you as the primary point man and the governor's physicians advisory group coming out and saying that you don't stand by these tests, but then we have the governor saying that, hey, we've continued to have zero positives. If we keep this up, we're going to reopen the island. You see there's a little bit of a mix?
Yeah, maybe my word choice was poor. And so what I meant by I stand by them to the best that we can, and that we're going to continue to use the best that we can. But my main point in saying that was that no test is 100%. So that's why if we believe that there was really zero tests and we're 100% confident with that, then yeah, we'd be reopening right away. But we know that that's not the case, and then that we know that it's not a true representation of what's actually going on in Guam, which is why we have to be extremely careful, because nothing we're doing is 100%.
Right. So are you saying moving forward, we're no longer going to be using the VTM for the test that we conduct with the Abbott ID machine? We're going to use saline solution?
I think that's going to be looked at extremely carefully, and we're going to try and understand that a little bit more. Now, there's even more other corollary studies that are being done. And so we're gonna dig deep into that and then really ensure that we understand that, especially before Saturday.
Okay. How many people are you guys looking to test on Saturday? I know that the mayor said it's 400 to 500 people population in that Saginaw, but we're only looking for people that have mild symptoms, right? Is there like a sample size that you're targeting?
Yeah. So public health is leading this effort, and they're the ones spearheading. So I can't comment too much on the operations part of that. But at least from my understanding, I believe they're looking to test, around 1 to 200 or so. I think they will have the capability to do that on Saturday. But it's only, I believe, from 9 a.m. to 12 p.m. For that 3-hour window. So that time itself might be the limiting factor.
But if Dr. Cabrera was calling the shots, how many people would you want to see get swabbed on Saturday?
Well, I think that it's really going to come down to how do we test safely, because again, even though they're coming in, we're still going to practice everything in terms of
right.
social distancing and
right.
and all that. So just to push that on, it's just not a fair part here. I just want to really quickly just make the point that I talked about also people making sure that they try and reach out to their primary care doctors and get their maintenance care taken care of, and that they should feel comfortable leaving the home to do that. So it's not saying that we're rolling back our stay-at-home orders. That this has always been in place. That you should be able to leave your home for essential purposes. Right. It's just that what people they seem to forget or don't understand people seem to not put into weight the true value of actually seeing your doctor for preventative measures, right. And we think that's extremely important. It's as important as going to the grocery store to fill up on food, and so we want to ensure that people understand that and they do that, and that's a very appropriate exception.
Yes, I think it's just that people got used to hearing "stay home" and then "stay home, stay home."
No, stay home, but
but the essential stuff, and this is something we talked about with Dr. Hoa, is we don't want these people with chronic disease who are not doing the maintenance they need to do to take a nosedive and have to be hospitalized and take up
And then if you're feeling ill and getting tested, that's also a very reasonable exception to the stay-at-home order as we enter this new phase, the dance phase.
Okay, Doc. Thank you.
Yeah.
Hey, appreciate it, Doc, so much. Appreciate your time.
Thank you.
Take care of yourself and each other.
Okay,
right.
You got it.
Be safe.
Wash your hands.
Yeah, thank you. I will.
Okay, Doc. There you go, Dr. Felix Cabrera. We're about to flick the switch and jump over to KUAM TV 11. So thank you, guys. It's Containing COVID, the KUAM News takeover of Guam's favorite I-94. Good morning.
Be healthy. Be informed with ITD. Be healthy. Be informed with
New self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
It's the KUM News containing COVID takeover Guam's favorite I-94. It's 8:08 again. We're KUM FM Hagåtña. And the show all over, the many ways you could jump on. Of course, right here on the radio where it all began, 93.9 FM. We're also streaming on the KUM News app and at KUM.com. There's an audio stream on Docomo Channel 10. But right now, jump over to KUM TV 11 where we throw the last 2 hours of the show onto the TV for you guys to, drink your coffee and dip your biscucho and all that. And then also on our KUM News Facebook where, again, we wish a happy birthday. Very happy quarantine, isolation, mandatory social distancing orders birthday to Sabrina Salas Mantanani. Happy birthday, Bree.
Thanks, guys.
She's like, I'm over it. Okay, that's it. I think we could sing happy birthday again if you want.
You should get your guitar.
Okay.
Your guitar.
Your guitar.
Your guitar.
So it's 8:09 as we do in this hour, and when we start the show at 6, we do a deep dive into the day's COVID-19 news from the KUAM News team. Good morning, Sabrina Salas Mantanani.
Holiday, good morning, everyone. According to the latest from the Joint Information Center, released at 9:45 last night, Public Health tested 34 individuals for COVID-19 on Wednesday. 0 tested positive. However, 1 additional case did test positive through the U.S. Naval Hospital, Guam. That brings the total number of confirmed cases of COVID-19 on island to 137, with 5 deaths and 119 recoveries. Public Health, they're gearing up for the community pilot testing project at the Estumbo Gym scheduled for this Saturday. Here's Public Health Director Linda and Pinko DeNorsi.
The reason why we're having it at the Estumbo Gym is because a lot of the targeted group that we're emphasizing on is living in areas, as I mentioned, that they don't have transportation. So we want to make sure that we cover these barriers to care. And so that's the reason why we want to do both the drive-through simultaneously with them walking straight up to our staff, and they'll have the nasopharyngeal swab. So we'll have 3 teams that will be working on this. The gym is ideal because also it's a gated, and we can control the traffic coming in and out. We also will have the tag. The tag will have her team with the National Guard to control the traffic, and also the security will be in place with our Guam Police Department. We'll also have the emergency response team there in the event anybody should have any emergency issues. And of course, 1 physician will be available during this time. We also have decontamination procedures. So we have to ensure that our staff, our nurses, will don all their PPE, and they will decontaminate themselves as they get in contact with patients. And so in a nutshell, we're also going to advertise it through the mayor, of course, and our staff. And that information will be disseminated to them. And we're hoping that this pilot project, which we're aiming to just get a small count to start off with, as it's called pilot, so that we can be able to identify these areas that they may not have presented themselves to the clinic, because again, as I mentioned, They may have no insurance. They may be uninsured. They may have barriers to care like transportation. They can't get to the clinic for whatever reason. They don't have a car or they don't have anybody that can drive them. They can't take the bus or whatever. You know, we're doing social distancing. So these are the reasons why we want them in these pocket areas. And so by getting that type of information, we can identify anyone that could be infected, regardless of their ethnicity. And once we identify if there is an infection there, we then launch our team to begin the investigation, to do the contact tracing. So later on, when we know that this person is positive in the household, we can identify contacts, i.e. household contacts and close contacts, so that we also want to test those in the household with this positive person to determine if they, even though they're asymptomatic, we want to test them. And of course, we don't want everybody in the household. We want to make sure that there's no cross-contamination occurring so we can control the transmission of this disease. And by doing so, we will assess if they have a condition in their home that's suitable for all of them to live in. If it's not suitable, meaning you may have an elderly in that household with that positive patient or another family member that has also comorbid conditions, we don't want all of you in that house. So what we'll do, we'll take out the person that is positive and put them in our government of Guam isolation area. And then from there, we move on. Isolation area. And then from there, we move on.
All right, the community pilot testing program, it is this Saturday at the Estumbo Gym from 9 a.m. to 12 p.m. According to Melissa Zavares, the mayor of the village of Dededo, this is for testing for the immediate community around the gym. This is the Saganlanadzan area. Again, if you have mild symptoms, please go to the gym this Saturday and get tested. Meanwhile, with increased testing capabilities and Guam entering this new phase of testing, it will help in the governor making her ultimate decision in reopening Guam.
So you mentioned in your opening statement and that it's up to the community. It could be 2 weeks or 2 months. Do you foresee a possibility of opening in 2 weeks? And have you given thought to which businesses you would allow to open up first?
So these questions are being reviewed by our recovery panel advisors, Nestor, and it's very dependent on whether it's 2 weeks or 3 weeks from now. Is dependent on the data and information we are going to be getting.
So you mentioned in your opening statement and that it's up to the community. It could be 2 weeks or 2 months. Do you foresee a possibility of opening in 2 weeks? And have you given thought to which businesses you would allow to open up first?
So these questions are being reviewed by our recovery panel advisors, Nestor, and it's very dependent on whether it's 2 weeks or 3 weeks from now. Is dependent on the data and information we are going to be getting in the next 2 weeks with our expanded testing. And so I mentioned yesterday what are the triggers, right, to indicate to start opening or start loosening some of our restrictions. And of course, capacity of the hospital is one. Its ability to be able to take care of COVID patients if we start seeing surges. The 14-day period, which is 14-day from the last case that you see or the lowest case.
The governor's economic recovery panel of advisors should have their plan finalized by Friday. Thousands continue to line up for food through the Guam DOE Grab and Go Meals program. More than 1,000 have applied for public assistance and federal aid via stimulus checks and unemployment assistance. COVID has had a direct impact on island residents. The question continues to be asked by local media. What about local assistance to bridge island residents until federal financial help arrives?
I am very concerned about our people, of course. I'm very concerned that we keep them safe. I'm concerned that we keep them healthy, of course, and I'm concerned that they're able to provide for their families. And that's why we advanced the economic recovery program forward. We are also looking at speeding up our tax refunds because we still have those that would be available for our people. And of course, public assistance is there. And we've been tracking the public assistance volume and eligible people that are enrolled, and we have been seeing about a 59% increase in public assistance. That's your cash assistance program, that is your SNAP, because there is a cash assistance program through public health. We have a SNAP program, which is your food stamps, and of course, MIP with your health care and Medicaid also. So there are currently existing local government assistance to help our people. Additionally, Nick, with these people that already have approved with their paid protection loan program, those businesses can continue employing these individuals. So even though the business is not open, but you now have a loan with the paid protection program loan, then you can continue paying those employees so that they can continue to have the means and the income to provide for their families. And of course, you know, that program is such that if you, whatever percentage that you are using to, from your loan to pay for your payroll, that loan portion will be forgiven. And so it's really a method to give outright federal grants to encourage employers to continue employing their individual employees.
Day and runs through the 28th. The summit is being held in conjunction with Graduate School USA. Attending are members of the legislature, business leaders, and members of the public to address the Commonwealth's fiscal challenges as a result of COVID. The summit will build up on the findings of the governor's fiscal response task force. As reported, CNMI Governor Ralph Torres weeks ago announced the furlough of government employees as a result of seeing a reduction of almost 50% in their budget because of COVID. Additionally, PSS employees had a payless payday. There are 14 confirmed cases of COVID-19 in the CNMI. As for the latest with the USS Theodore Roosevelt, according to the latest numbers released this morning, 99% of the crew have been tested for COVID-19, with 777 total positive and 3,919 negative. Of the total positive cases, 63 sailors have recovered. 4,196 sailors have moved ashore. 6 sailors assigned to USS Theodore Roosevelt are at Naval Hospital Guam, and none of the sailors are in ICU. Meanwhile, sailors in quarantine at the hotels will remain in Tumon longer than initially planned. According to Governor Lulian Guerrero, she was informed by Joint Region Marianas Commander Rear Admiral John Manoni they need an extended stay. The governor saying Admiral Manoni had hoped to have everyone back on the ship by this weekend, but the Navy wants to keep them for one more week to make sure they go beyond the 14-day quarantine, which is the life cycle of the virus, to make sure that when they set out to sea, they won't have any incidents of COVID. On Wednesday, the Navy announced that 42 sailors that initially tested negative had tested positive for COVID. Currently underway, the Navy, along with the CDC, is conducting a serology study into the outbreak on the carrier. Results aren't expected for about 1 month. In national news, the director of the CDC says the coronavirus could take a second swipe at the country this winter. The warning comes as more than 45,000 Americans have died from the virus, and word that the first death came 3 weeks earlier than first thought. Tom Hansen reports from New York City.
In a Washington Post interview, CDC Director Dr. Robert Redfield says the U.S. could see a second wave of coronavirus next winter. FDA Commissioner Dr. Stephen Hahn addressed the prediction on CBS this morning.
It's certainly a possibility, and the whole task force set of doctors is concerned about the second wave. And Dr. Redfield's concern is that there also might be flu at the same time.
The FDA has also authorized an at-home test for the virus. The first batch is going out to first responders who have COVID symptoms.
Lack of testing has been a problem nationwide, and it's believed that cases and deaths are far higher than reported. New York's governor secured double the amount of testing after an in-person meeting with President Trump at the White House.
California is now the first state to recommend testing for all residents, regardless of symptoms. Michigan's governor says her state is still short on testing supplies. The family of 56-year-old Gary Fowler of Michigan says he was denied testing 3 times before he died.
He was begging for his life, but no one would help him at all. Like, they just kept sending him away.
Despite lack of testing, many states and communities are moving to start opening up their economies. Georgia's Republican Governor Brian Kemp has come under fire after announcing his state will begin reopening Friday, even as the number of cases in Georgia continue to rise. The city of Albany, Georgia, has one of the highest per capita infection rates in the nation.
I pray that the number of Georgians who are infected and die will not increase significantly in the coming weeks as a result of the lifting of these restrictions.
Among the White House criteria for reopening is a 2-week downward trend of COVID cases. That's a standard Georgia has not yet met. Tom Hansen, CBS News, New York.
New testing has found the first coronavirus U.S. death was not in Washington state at the end of February as previously thought. The new first known victim died in Santa Clara County, California, 3 weeks earlier. And finally, in order to win the war against COVID-19, it's going to take all of us to do our part. We're all on the front lines of this battle. And on Tuesday, May 5th, we're asking you to answer the call to help by taking part in Giving Tuesday Now. This is part of a global initiative setting aside this one day specifically for the pandemic crisis to step up and give a donation to any of our island's nonprofit organizations, whether it be the hospital, the mayor's council, or any of our frontline heroes. Whether it's PPEs, gloves, masks, canned goods, no donation is too small. Anything and everything will help. And when you do make your donation, take a picture of it and post it on social media using the hashtag #GivingTuesdayNow and Giving Tuesday Guam. And then later that evening on Tuesday, May 5th, join us for a half-hour special showcasing how Guam gives.
Thank you very much, Sabrina. Hey, and we want to just pop this up on, you guys got the video, right? So Farm to Table is doing a drive-through farmers co-op in Dedido. It's actually ongoing now. They start at 8. They go all the way to 12. They're accepting cash only. And we talked about the plight of local farmers and how a lot of their produce, because the demand, well, it's not really even the demand. It's that they're limited in how they can get this stuff out there. And, of course, with the closure of all the flea markets, that took away the lifeblood of, so many on our island who, basically hustle for a living, man. So Farm to Table with this farmers market. It's at the Farmers Co-op in Dedido, cash only, 8 to 12. And we got some video that Jason threw up in there. And that's how you could see they're adhering to the social distancing with the 6 feet and line and all that. And so really want to just thank them for that. That's pretty cool. And also, something else you guys might want to know for today is Wendy's. Let me get that up there. Where did that go? Yeah, he's got. Oh, okay, I see it.
I saw it somewhere.
Yeah, it's something with.
Here it is. It's available. Right?
They're giving out a free 4-piece spicy and crispy nuggets at Wendy's.
Group nug, right? Group nug?
Not a group hug, it's a group nug.
Group nug. And this is Friday. Yeah, this Friday.
Right. Okay, so that's a heads up for you on Wendy's. Again, just trying to get you, a little food, man. If it's free, if it's a little something extra, a little more bang for your buck. 8:27, let's head over to the NMI, where a man in the CNMI is here to report on the latest with COVID-19 in the Northern Marianas. Tomas Manglanya. Good morning, Tomas.
Hi, Tomas.
Good morning. Happy birthday, buddy.
Thank you.
You're right. So it's still going to be your birthday there in the NMI tomorrow.
Yeah, so you know what? I think I'll eat a cake for you here.
Right. So, Tomas, if you could, just the very latest with what's going on COVID-19 in the CNMI.
Sure, and so I just wanted to provide the latest on what's happening here in the Northern Mariana Islands. I followed up with regards to the Abbott's rapid test kits that now national media reporting can produce false negative results under certain conditions. And so, as we know, the 14th case that was confirmed here in the NMI, unlike previous testing at the Guam Public Health Laboratory, The most recent case was confirmed at the CHCC laboratory using this ID now by Abbott Alir. We reached out to the Commonwealth Healthcare Center Corporation CEO Esther Muña early this morning. She tells us that that the solution that they're raising problems with is not used at CHC, so the collection doesn't get diluted. She explains that the CNMI followed instructions and have the capability of doing so since collection is done and testing is done at the Commonwealth Healthcare Corporation. She says that she verified this when she saw national media reports about the device and that her staff informed her of the matter. And so that's the latest with regards to that testing capability. The CNMI governor's press secretary also reassuring the public that the ID now that is used properly is just one of 5 different testing platforms that are available in the NMI. And moving on to the Department of Public Safety, they say that companies that are conducting business during curfew hours are asked to have employees to carry proper ID and have a designated company point of contact. The Commonwealth Department of Public Safety noticed a slight increase in vehicles driving through roadways claiming that they are heading to or from work during curfew hours. As a reminder, those curfew hours are 7 p.m. to 6 a.m. here in the CNMI. And they're asking that during this time they want to be able to validate employees who are on the roadways due to work schedules. They say that the Department of Public Safety will continue to conduct mandatory traffic stops on vehicles utilizing the roadways during these curfew hours. And as we reported, the governor, CNMI Governor Ralph Torres, in collaboration with Graduate School USA, is hosting that Fiscal Response Summit. It's going to be happening in just about half an hour from now. The summit's running from the 23rd to the 28th, and we have all 3 branches of government there, business leaders, and members of the public, and we'll definitely be tuning into that once it starts in about 30 minutes over Zoom to discuss how they're going to address the fiscal challenges in the CNMI caused by COVID-19 global pandemic. And so that's the latest information we have for you right now. And just reminding viewers, at 11 a.m. we'll be interviewing the Executive Director, Macy Tenorio, of the Coalition Against Domestic and Sexual Violence here in the NMI, to talk about what type of support exists for survivors and maybe folks who want to assist survivors during this stay-at-home time.
All right. Thanks, Tomas. Again, that's 11 a.m. on KUAM's Facebook page live, right?
Yes, that's correct,
okay.
11 a.m.
All right. Thanks a lot, Tomas. You be safe.
Thank you. You too. Have a good day.
Okay. All right, Tomas Manglanya, thank you so much. Our man in the NMI, 8:30. You had a little more info on what Farm to Table is doing. If they got an Instagram, follow it.
Yeah, that's where I got the information
Right.
off their Instagram. That drive-through farmers market, it's going on until 12 o'clock or until they sell out. They have an abundance of cucumber and calamansi and limited items such as eggplant, bitter melon, papaya, lemongrass, marigolds, egg fruit, hot pepper, passion fruit, manzanita cherries, guava, Malabar spinach, sweet potato tips, umbrella. Did I say that right?
Yeah,
umbrella?
you guys got to eat your...
This is similar to mini green mango and local honey.
Wow. Eat your fruits and vegetables, guys.
Right, and it's cash only.
Yeah. And it's a great way to help these farmers out. You know, a lot of farmers, they can't get, the vegetables to the store. Some of the stores are closed. Some of them are, cutting back on what they're buying because of the COVID crisis.
Right. It's at the Dededo Farmers Co-op. Stay in your car, wear a mask. Produce will be pre-bagged. No pre-orders. It is first come, first served basis. Prices are posted. Again, it's cash only. Yes, Jason? Farmers aren't going to be there, and they're selling them on behalf of the farmers. Now, go on to their Instagram page right there. You could see it. If you are going to do bulk orders of cucumbers, make sure to DM them and let them know. But that is going on from up until 12 o'clock this afternoon, or until they sell all of the produce.
Right, and then later on in the show, I'm going to get Kristen from Guahan Sustainable Culture. These guys are also doing something that's really cool. They've started a GoFundMe to buy local produce from farmers and then give that out, I think, to people who need it. And there's definitely a lot of people who need it. It's 8:31. Let's go to the phones now, where we have from the surgeon cell, Sergeant Fernando Estevez. He's the Medical Operations and Logistics Coordinator for the Cure Task Force. And so I just wanted to get him on as... good morning, Sarge.
Oh,
okay, let me try that again. You want to do just the results real quick, and then I'll get Sarge on the phone?
Okay, the latest numbers from the Joint Information Center. If you haven't memorized it by now, it was released at 9:45 last night. They ran 34 tests on on Wednesday. 0 from public health tested positive, but there was one result that did come back positive, and that was from the Naval Hospital. So the total number of confirmed cases stands at 137, with 5 deaths and 119 recoveries. And again, recovery means a patient is no longer considered infectious.
All right, there we go. Let's do this again. From the Cure Task Force, I believe he's also part of the Sergeant Cell out of the National Guard, Sergeant Fernando Estevez. Good morning, Sarge.
Off the day, Chris. How are
Good morning.
You? Good morning. We got Sabrina here, too. It's her birthday, by the way.
Off the day, Sabrina. Happy birthday.
Thank you.
So, Sarge, obviously you've worn a lot of hats, and I just think it was kind of interesting when I saw you in the press conference. I had to kind of do a double take. I was like, wait a minute, is that former Senator Fernando Estevez up there?
Yeah. I was activated. I came on board on the 1st to provide assistance. So with regards to medical planning and logistics specifically, which is part of my bread and butter when I was active duty in the Army.
Right, and so I guess just first of all, Sergeant, if you could talk about what responsibilities you have and what you're, what do you kind of do with the Surgeon Cell and how it relates to the COVID response.
Sure. So I'm the Medical Operations and Logistics Coordinator. So what I do, kind of from a macro, if we go back to what the cure was intended was to unify and coordinate the different elements, both public and private, that we have in terms of medical assets on Guam in order to have a unified response towards COVID. And so what I do is I coordinate those efforts. I track progress as for both operations and logistics, and then focus on executing the different initiatives that was mainly part of the initial and medical surge plan that we were working towards.
I guess.
Can you just kind of speak English? Just break that down because I'm not sure what you just said.
Do you have permission to speak English, Sarge?
So in the simplest way, right? There were challenges that needed to be met. So there was the expectation of a large surge of medical patients. And so part of medical operations is understanding in detail what Guam's current capacity is, and then working to execute the plans on how to expand that to get as close to, if not to meet, the medical capacity challenges, really to save lives ultimately. And so it's coordinating all of those pieces and executing all those plans and individual actions that need to happen.
And so you also, and I guess you're responsible for procuring, getting all the equipment that's needed medically for the response to COVID-19, right?
I mean, that's part of it. So the different agencies and even the private facilities all have their own medical materials sections. And so, right off the bat, we encourage them to continue to use their vendors to keep processing. But what I do is I track the daily numbers for every individual facility. I use CDC methodology to calculate their predicted burn rate, so I can see when they would or could potentially run out. And then as well as I source and verify other vendors to add onto the list for additional orders through FEMA, Homeland Security, and such.
Right, so you're the guy who's keeping track of how many PPEs we got and how many
test
kits and all that
Correct.
stuff. Right. Yeah.
Correct.
Can we just go back to this customs thing? There appeared to be a lot of confusion about what that order actually enabled the government to do. So could you just maybe unpack that and maybe offer some clarity? Because I've asked to get Chief Pareto on, but he hasn't had the availability, at least for this station. So if you could, Sergeant.
Sure. Well, I can't speak. He'd be a better individual to ask in terms of the enforcement of that and, the government's ability to confiscate. What I can say is to date, I'm not aware, as the logistics coordinator, of any PPE that's been confiscated by the government. But what I can directly speak to is that, one of the big things is and this is a national issue, is the safety issue regarding importing counterfeit items. because they can really be problematic and a danger to the community in general and the medical community more specifically. And all of those things could have a big negative impact on our medical capacity.
Mm-hmm. You said PPEs. You weren't aware of any PPEs that were confiscated? Is that what you said?
Correct.
What about like test kits or other sort of medical supplies?
So as far as test kits go, there was one set of test kits that were brought in because of concern that they might be counterfeit. And so part of what I've been doing, I've been working, and I made myself available to different medical supply vendors locally and internationally to make sure that those products are vetted beforehand. So that one in particular, I guess the purchaser was under the impression they were FDA approved, but the manufacturer was a bit deceiving in that it didn't have U.S. FDA approval, only Philippines, which according to U.S. FDA is not authorized for use.
And how many test kits are
in that quantity?
Yeah.
I want to say there were about 2 boxes. I can go back and look at the inventory to get that exact amount.
Like 2 big boxes or like 2?
No.
So are we talking like hundreds or thousands?
I'd say closer to about maybe 1,000.
Okay.
Mm-hmm.
But again, these are also, at least these specific tests are IgG, IgM, which are not definitive types of tests.
Okay.
Do you know what happens to them?
I don't.
That would be customs.
That would be above me to make the call what happens to them.
But they're not allowed in the Guam.
Correct.
Okay.
And the reason for that is because they don't have the FDA, either the preliminary or any kind of approval from the FDA, the EUA.
I think the easiest way to say it is yes, they don't have any approval from the FDA. There's really that's kind of a misnomer. There's not really anything. There's no such thing as a preliminary or pre-approval. It's either approved by the FDA under their regular auspices, their regular operations, which is the most stringent in the world, or under the emergency use authorization.
Are any test kits officially FDA approved?
Oh, yes, absolutely. I want to say on that list there's maybe about 40 manufacturers, and almost daily there's a new manufacturer of tests.
Wait. I mean, are they officially FDA approved or
do they have the
EUA?
emergency use?
Oh no, there are no test kits for COVID-19 that are officially FDA approved.
But what they do have is the emergency use authorization, right?
Correct.
Okay. So that's are you able? Could we talk about these South Korean test kits? I mean, you as the logistics officer, I'm just wondering, logistically, are there any of these South Korean test kits? Because I know there are people trying to push it for the mass testing, but are there any? Because I'm confused. I've gotten the links, but I've been told by doctors on the Physicians Advisory Group that if you go to the FDA website, it's really hard. I mean, it's hard. It's a hard website to navigate. It's huge. But are there any South Korean test kits that have the emergency use authorization from the FDA?
So of the 3 that have been highly publicized, 1 received theirs on the 18th, and so by the next day on the 19th, I was in communication with them to try to get more detail into their product, and then also look at the potential of acquiring them. And so those discussions started right away. I monitor and I'm in contact with the FDA as needed, but I monitor that site to look at new listings multiple times a day.
I see.
Are any of the test kits? Do you monitor the test kits that are coming in from FEMA?
I do.
Are any of them from South Korea?
Say again?
Are any of them from South Korea that they brought in?
No, to my knowledge, none of the test kits that have arrived from the CDC or FEMA were of that batch from South Korea. At least those that have been publicized. They've been for the existing machines that match the current ones we have that were provided by FEMA. So like the Abbott Gene Expert, for example, the ABI 7500, and so those those testing machines that were provided by the federal government, they have been supplying and supporting with test kits and other consumables to utilize them.
How many test kits did we get from from FEMA?
So I'll go back. I'm not in the office right now, but I can get that total list from you.
I mean,
and public health will have that as well.
Right. So, I mean, are we talking hundreds, thousands, maybe just ballpark?
Yeah, I'd say at this time hundreds, but they're wrapping up their manufacturing, and at least what I can say, and public health is more in direct communication with the CDC regarding what they're supplying. We're expecting a steady supply from them ramping up. And so you have to understand, when this whole thing started, if you stay up to date on the CDC pandemic plans, FEMA, all of the studies kind of showed the same scenario, that there would be, an approximate 3-month delay before manufacturing catches up. And so based on all of those studies and guidelines when we first started, that was the initial target goal, was to make sure logistically, in terms of supplies, PPE, equipment, testing, we were getting to a point where we're going to meet that capacity and to hold the line until manufacturing catches up. And when you monitor the FDA and in terms of what's being recently approved under the emergency use authorization, those numbers are ramping up quickly. And I'll give you an example with the masks, the KN95s. Generally, they're not accepted at all, but those certain companies that meet those specifications under the FDA, I want to say about a week and a half ago, there were 3 manufacturers in China that met that. Today, there's about 78 manufacturers that meet that with those masks. Same thing with the test kit. And so if looking at it from that point of view, you can see manufacturing is catching up, and a lot of these supply chain issues are going to be alleviated, each day that passes by.
Sarge, could we just maybe this, and I don't know if you can speak on this, but just specifically with there was an effort by Speaker Tina Munoz Barnes to and former Senator Dennis Rodriguez to conduct mass testing with South Korean test kits. The ones that they have you researched the South Korean test kits they're talking about, and do they have the EUA or not?
So that particular test, the Solgen, does not have an emergency use authorization. When that was brought to my attention and I was asked about that, I immediately contacted the FDA, and I actually called them twice at different parts of the day to make sure that the answer was consistent. And so there is no EUA for the Solgen, and I want to say more than a week ago when I contacted them, and I've been monitoring ever since. Now, what they were able to confirm is that an application was submitted, but they make no guarantees that just because an applicant submits an application, that the FDA is going to grant an authorization, because there's a burden of proof that their product says it's going to do what it's going to do. And so generally and typically there's about like a 2-week time frame that they say that they work to get an answer on an authorization. And so, we're in communication with them to get any updates for additional testing capacity. Right, because there's a letter that had come out from the Speaker's office, and it seemed to imply that they did have the EUA, but then there was something about they had checked the website, and it got a little confusing. But it did. So I can speak on the first test coming out of South Korea of those 3 was the Osang, which came out on the 18th. And it's important that people understand the context of texting. I think there's a huge misconception that all we need to do is get the test kits and then we can run the test, but that's very, very far from the truth. So for example, when I was in communication with the manufacturer, their minimum order quantity was 100,000 test kits. That's the minimum you can purchase. 100,000 tests, which seems like an easy sell. But when you actually do the logistical portion and put the work behind it, it would take us, with our current testing capacity and the machines that are compatible with that specific test, it would take us 4.5 years to use those test kits, and the shelf life is only 1 year. And so part of what we do is we go and we look at these different offers, and then we see, what are the limiting factors, what are the different courses of action to potentially make this happen. And so, I use that example with the one ABI 7500 that's compatible. It would take 4.5 years running it 24/7. And so many factors go into that. Do we have enough, and can we procure enough VTM, viral transport medium, to process all those tests. And there's also a nationwide shortage of that. We have test kits right now that we're still waiting on BTM in order to utilize those test kits, and that's been an ongoing thing. And so from a logistics point of view, we have to match up certain things. One, the testing machine. Two, the test kit that's compatible. Three, the viral transport medium and for the specimen collection and transport. Four, a certified lab technician. Five, a certified lab that machine can run in. And then the sixth one being the reagents required and needed in order to make sure that the machine is calibrated so we don't get false and bad readings.
Sarge, maybe just a short answer. Is the plan that Speaker Barnes, the plan that she and former Senator Dennis Rodriguez, that they offered out using these, South Korean test kits, is it logistically impossible to execute that level of mass testing that they're talking about?
You're talking about testing for the entire island.
Right. I'm just talking about the proposal that has been put forth by the Speaker and former Senator Dennis Rodriguez from the Speaker's Physicians Advisory Council.
So Chris, I did look over the proposal. As to whether or not it's impossible or not, would not be my call to make. Again, I'm an activated uniformed personnel, and if I'm told to make the impossible happen, I'm going to have to find a way to make the impossible happen. So I wouldn't be the appropriate person to ask whether or not that's something that can be executed because it's on the policy side.
Right. I mean,
sure.
I just think we beat this issue to death. I think it's done.
What
it's
I
not
can
going to
say,
happen.
what I can say is that in order to even maybe assess the feasibility, right now we have a lot of things ongoing, but I think from my clear understanding of the governor's intent regarding the use of FDA approved either through the regular process or emergency use authorization, that intent has been made clear to me. Now, so what I can say is, in terms of visiting that plan, it's going to be contingent on the type of test and what test they're using. But going back to one of the logistical challenges that could potentially pose with that is that any test that has an emergency use authorization also has requirements on how that test is processed. So, for example, each one of those EUAs will make the determination whether it needs to be in a CLIA certified lab that can run and is certified for moderate complexity testing or high complexity testing. So that's another thing that we have to match up. Also with the certified lab technicians that are going to be able to run those tests properly. Because again, just having a test is one thing, right? Mm-hmm. Being able to use it is a whole nother discussion.
Right. I think it's a dead issue. We're not going to see these South Korean machines or whatever. We're going to stick with our ABI and our Avid ID or BDNet.
No. But what I want to say, Sabrina, it's not that it's from South Korea. I mean, because again, the OSANG is a South Korean-made test,
right?
And there are Chinese-made tests as well. That has nothing to do with it.
It just hinges on the EUA, right?
Correct.
Right.
And not just the EUA, but the requirements in that EUA that need to be followed.
Okay.
Again, so the lab requirement being one specific one, that's always up and definitely a logistical headache.
Oh no, I'm just saying we've got these 6 testing machines these machines. So it just sounds like we're going to stick with this. We're going to get the test kits that are compatible with this.
I mean, it's clear that the governor has her plan to execute. Sarge, I want to go back to what we first talked about. Is you said that you were responsible for building everything up for this projected surge. And is this projected surge from the first major trajectory that Dr. Cabrera had presented? And then I guess my follow-up question would be, if so, how have we retailored our approach given that we now have a new trajectory plan?
So that I can definitely speak to. So in terms of what the trajectory can be is still a possibility, right? It's still a very plausible worst-case scenario. And so, again, we want to plan for the worst and hope for the best. So the plan on how we were going to execute based on what Guam has in terms of medical assets, facilities, supply, resupply, equipment, personnel. The plan is that we now still acquire those things that we're short on, such as ventilators, for example, stockpiling PPE, and we look at how can we now take this plan and prepare for a second surge, not necessarily have everything stood up, have tents outside like we're just waiting, but to be able to turn it on very quickly if we see that surge arise, right? So it's taking a lot of the existing product, making some minor modifications in terms of execution dates when we were going to have this stuff ready to go, and then pull it back and make sure that everything is sourced. There's a plan. We understand all the shortfalls, and we're taking those lessons learned. So really, what it'll come down to is we can almost turn on the switch, and we'll be ready to increase our medical capacity greatly.
Mm-hmm.
All right.
I wanted to ask about since you do work with the supplies. Have you been told to I guess slow down on ordering these VTMs because of the news about the Abbott ID devices and how these VTMs, these viral transport medias, could produce false negatives?
So the VTM, that VTM issue specific with the Abbott ID now,
right.
But the other machines that we have that run PCR molecular tests, it's still absolutely very crucial. So, I read that documentation, and it really is specific because the Abbott ID was designed to be a point-in-care type of test. Really, their bread and butter and their best use is, for example, in the emergency room of a hospital, so a patient can be cleared very quickly on the spot before, and so that the staff and the medical staff and workers are aware whether the patient is positive or not.
And so we spoke with Dr. Cabrera earlier, and he said that with the Abbott ID, one of the decisions that they're really looking at moving forward is placing these swabs in a saline solution, and then I guess that would eliminate, the potential for the false negatives.
Correct. So, we're looking at that I'm looking at that with all of the individual machines because depending on the specimen, you can put it in a VTM, a viral transport media, a universal transport medium, or a sterile saline type solution. And so remember, this is, again, a lot of it is very ongoing. And things like what we saw with the Abbott ID are exactly the reason why things normally go through a very stringent FDA process. And so, there's been a lot of relaxation on a lot of those policies with regard to the emergency use authorization. But again, as much as possible, that golden standard is maintained throughout the crisis, and we don't devolve into panic buying without any thought process behind it in terms of logistics or feasibility. Because what I can say confidently is I don't think anybody would be happy about 100,000 test kits sitting around not able to be used.
They'd probably be pretty pissed off about it.
It's in a crisis, it's almost a lose-lose situation. But the work continues, I'm here to do a job, and I'm just going to keep doing it to the best of my ability. Me and the team.
How are these medical supplies and equipments and PPEs being purchased? Do we go direct to the vendor, or do we go through like a local company that brings them in?
There's multiple avenues. So as I stated earlier, public health, GRMC, GMH, for example, and even the private clinics have their own medical supply chains, right? And so what we do know is that in this crisis, what people and what medical material suppliers are used to having is they would place a large order. It may be on back order, but that order would get filled, right? So there's a lot of stress and anxiety in that chain because it's very out of the normal. Luckily, having been in the Army and deployed in austere conditions, I'm very used to those types of situations. And so what we want to plan around is what's kind of called a trickle-in type of supply economy, where it's not necessarily we're going to get our bulk order of 50,000 masks or 100,000 masks. We're going to order and source from multiple vendors, and as they parcel out and partially fill all those orders, we need that trickle-in effect to match our daily usage. And if we do that, then we're never going to run out, right? It's almost like you put in $5 in your gas tank just to get to where you need to go, and then you put in another $5 to somebody who's used to filling up their tank when they need to. And so that's probably the best analogy that I can use for that. So that's one way we're doing it. The other way we're doing it is also using the emergency authorization to now look at, and part of what I do is I look at a lot of the common items that are needed, N95 masks, gowns, for example, and we source them from larger manufacturers, vet the product and manufacture, and then we look at doing a bulk order. And then when that comes in, then it gets divvied out. Because some again, with the supply chain, some are able to provide small quantities. Others will only sell to you if you buy in large volume. So that's one thing we're doing from the macro, from the government point of view, is to order. So we're doing this from many different angles, as well as providing support and answering questions for local vendors who want to potentially bring in supply or who need to vet new manufacturers. And so we're working it two ways with the government, as well as the federal government, and then also the private sector.
Right. So they call you and they're like, hey, Sarge, can we get this? Is it FDA approved? And so they're basically making sure it's not going to get seized, so they're kind of clearing it with you preemptively.
Sure. And you would really be surprised, Chris, the length that some of these counterfeit manufacturers would go to try to get their products sold. I mean, we've seen fake registration numbers, certificate numbers, faulty tests. It's all they will go through great lengths to really deceive you. And so, there's an importer's guide that I developed that I know is getting vetted right now. And then the idea is that we kind of publish that out, update it constantly, and make sure that everybody has access to it, so that government purchasers, private vendors, and purchasers, as well as consumers, most importantly consumers and healthcare workers, can go and identify whether this product is valid or not. Because there's a very big danger with a counterfeit product, right? Something like an N95 mask that's supposed to guarantee a certain amount of protection is critical for a healthcare worker, right? Because if we lose a healthcare worker, we lose a huge part of our overall medical capacity, because it's more exponential, right? And then from a consumer standpoint, if you're buying an N95, right, or an equivalent, for Tan Maria, and it doesn't provide that protection, that's a huge issue, right, now and moving forward.
All right. Well, I think you're very thorough. Thank you so much. Anything else you wanted to add?
No, again, if there are vendors out there, medical supply vendors, and they need assistance, my contact number, they can get it at Adaloop. I'm hoping it should be on a website soon, so they can reach out, but I've already had people reaching out. And so, just hope everyone...
Wait. You're working out of Adaloop?
Correct.
Oh, wow.
How's that? I mean...
So it's kind of a ghost town up there, right?
Right, yeah.
Only the essential people are up there, so, they were nice enough to give us a workspace to operate out of within there. So it's a facility.
And I know you're uniform, you got the uniform on right now, but, I think it's interesting that, given obviously your background as a former elected leader, that we now see you in the uniform. And that's where you kind of just put everything aside and you got that job to do, right?
And working out of Adaloop.
Yeah. No. Absolutely.
Stop it, Bree.
I'm a National Guardsman. The governor is my commander in chief, right. And I have a duty, and really, I'm very happy to support her and the island and the people of Guam any way that I can. I really do believe it's a great honor to be able to bring the experience that I've gained over multiple deployments and years on active duty serving the federal government and serving, the overall federal mission. But to be able to do that for Guam and the island, it's the greatest honor. It really is.
Well, thank you, Sergeant. And definitely thank you for so thoroughly unwrapping a lot of that information, especially in English. We appreciate that.
And I appreciate it, Chris, and happy birthday, Sabrina.
Thank you.
Okay, there you go. Take it easy, Sarge.
Be safe.
Okay.
Wash your hands. Sergeant Fernando Estevez of the National Guard there. Of course, he's on the surgeon cell. Kind of leading, it sounds like, the COVID-19 response on Guam. And I thought it was interesting and that what he mentioned about they were procuring supplies and building our capacity based on that first trajectory that came out, the doomsday one. And then they've since kind of moved towards having these things ready. And the metaphor used was that we would flick a switch and be ready. So it's good to know someone's got a plan. 903, we're KUM-FM Agotnia. Let's go over to the phones and keep it going here with the Executive Director of GORA, Mr. Ray Tapasian. Good morning, Ray.
Good morning, Chris.
We also got Sabrina. It's her birthday
Hi.
over here. If you,
It's okay. So how are you?
I'm fine.
Oh, good.
Okay.
So I guess we just kind of want to just get right to it. A lot of people asking about this homeless plan. The plan to, I guess, maybe just tell us what is the plan with the homeless. Are we trying to house them? Are we trying to get them in one central area?
Well, yeah. I don't want to steal the governor's thunder because she hasn't formally announced that we're going to have a shelter. She did create a committee, and the committee's been coming out with solutions that we're going to properly advise her. And, as I said to the media, we need to be very careful not to create a situation where we create an environment that promotes COVID-19. So that's what's happening throughout many homeless shelters in the U.S. is there's a lot of positive cases. So we want to create an environment where there's social distancing. So it's a lot of thought is going, a lot of planning is going to go into this, and I hope the governor is ready to announce something fairly soon.
Are we still eyeing the Paseo area as the site for this temporary shelter?
Yeah, she did mention that Paseo is one of the areas that we recommended to her, and primarily because it's a large area where we can create that physical distancing. That wasn't the only option, but that was the preferred option, so hopefully that's the decision she goes with.
And then can you kind of, because people have been asking, Ray, what's the holdup, what's the deal, and we didn't get a lot of updates, but maybe if you could just, apprise us of what went into kind of making this decision and presenting it to the governor.
Well, we have to go down there and assess the place, although it's a large field and it's there's fencing where we can sort of create an environment where, these guys, these homeless folks, they haven't tested positive. Let me just make that clear. So there's no way we can detain them. So they'll be free to come and go as they please. What we need to do is we need to create a scenario where our public health officials, our medical officials can go out down there and initially start the health screening. And once that's complete, then we will bring in all the social service providers to include Catholic Social Services, the Salvation Army, Behavioral Health, Public Health, VISID, the Guam Housing Corp, Veterans Affairs. We'll get them all there so that we can help these folks. The primary purpose, I know there's been a lot of pressure on the governor from the legislature, from the media to get an update. But there's a lot of work that will go into this because we want to make sure that we don't create an environment where we're actually promoting the virus as opposed to trying to prevent the spread.
Yeah, and I think that's what the Lieutenant Governor had mentioned when he came on the show on Monday, talking about all these little pieces that have to be ironed out first before you actually open up this temporary shelter, and that's one of the things that's kind of held it back, the opening. But he did, right. So did they already repair the restrooms, the showers, and all of that at Paseo?
That's actually being done as we speak. There's also, we have to ensure that because one of the things we're thinking about is 3 meals a day.
Mm-hmm.
So we're working with a caterer to do that. The lighting at Paseo is not. When we assess the lighting, most of it's down. So we're working on that as we speak. I just got 3 price quotes today to repair the lighting.
Wow.
We're also looking at other things to entice them to stay. Again, we can't detain them.
Yeah.
So we want to create an environment where they want to stay. They want to take advantage of all the social services. They want to take advantage of the health screening. So we're looking at things to like possibly having a Wi-Fi tent so that they will, a lot of them are at Wendy's or McDonald's trying to utilize the
Wi-Fi,
the public library.
Right.
So what we thought is in order for them to want to stay there throughout the entire duration is we need to provide Wi-Fi. So we're looking into that. So again, a lot of planning is going into this. I don't know exactly what we'll have when the governor actually opens, but we have a whole team that's trying to consider all scenarios.
Mm-hmm. How many people, though, are you looking to house in this temporary facility? Is there like a cap?
Well, we don't know. And, the last point in time count, just for Agana alone, there were 76, I believe, street homeless.
Right.
So we're looking at anywhere between 75 to 100. And, those are going to be individual tents because, and we're thinking about having a tent per person or per family.
Mm-hmm.
But, I'm not responsible for that. For the logistics, it's actually the Guam National Guard that's helping us with that. Tim Uggan, he's the Homeland Security Advisor. He's kind of overseeing everything. Gura's job is really to get all the social services network there so that we can help these folks.
Mm-hmm.
Ray, is this going to be something that we're going to be able to get reimbursed, by FEMA or the feds?
That's the plan. I don't think the government have the money, or we would have spent the money to help these folks. I mean, homelessness is a problem nationwide, but hopefully with, there's a silver lining in all of this that we might be able to provide them the help they need because we want to get everybody there, including Department of Labor. So hopefully, if we promote healthy hygiene, maybe these folks will because there's shower facilities there. So we're going to be looking at, procuring shampoos, hand sanitizer, soaps. And one of the things that I made very clear to the committee is we need to provide masks or some facial covering throughout the duration. So we're looking at hopefully issuing something every single day while the shelter's in operation. So, it's a logistical nightmare, but we're up to the task.
Nice.
Well, hopefully, like you said, we'll get this announcement from the governor shortly. But from the way it sounds, it looks like we're moving towards this preferred option that you mentioned over at Paseo.
Yeah, the planning is proceeding, and it's just a matter of when the governor wants to announce because she wants to make sure that we do it right.
Right, and then when we announce it, it's like move in right now.
Exactly.
Right. Okay, Ray. I appreciate your time.
Anything else going on?
Yeah, anything else going on with Gura, landlords, anything you want to touch on here on the show?
Well, with Gura, I mean, we have part of our operations is essential, so we still have to pay our landlords. We've been doing that. We've been paying hundreds of landlords in a timely manner. We're paying out utility reimbursements, as you know, for many of the families that we house, about 4,800 families. We pay their power, water, sewer. So we're making sure that those payments are out. The only thing that we suspended under the governor's executive order really is leasing up. So I know there's a lot of people anxious because they've been on the waiting list. And we had a cabinet meeting yesterday, and we talked to the governor about slowly bringing back our entire operation. So we'll get there. We'll get there soon.
Okay, Ray. Hey, thank you.
Thanks, Ray.
Okay.
Appreciate it. Wash your hands. There you go, right to Boston of Gora. So, hey, you heard it here first. Something that we kind of put out was at Paseo. We heard from a variety of sources that we're looking at Paseo, and it kind of seems like it's a done deal.
This might be the place.
Okay.
And
9/11.
I think what's good is they're going to have medical checks for people. They're going to have the food.
They're going to have free Wi-Fi, dude. It's better
And
than
he said
jail.
behavioral health, right? He said
they're going to have free Wi-Fi to get 3 meals. They're making it nice, so you want to stay there. So, I mean, that's good.
I mean, you got to make sure, the 1 tent per person or per family because of social distancing.
Right.
I mean, you can't just put them there and be like, okay, see ya.
Right. Yeah, definitely. So it's good to see that there was and I touched base with Ray this week because I was hearing from the homeless coalition people that hey, where are we on this? We're not hearing anything, and I was like, hey, let's get an update out here just because we just want to be updated and people know.
And we've been talking about this actually for
a couple weeks, few weeks. Yeah. It's on our list. Okay, we always people who are struggling, who are suffering, who don't have enough food to eat, the homeless, the inmates, the detainees. So we're always kind of thinking about these situations. 9:13. We're going to get Juan Flores from the Catholic schools on the show in just a few minutes. But first, honestly, we got to take a bathroom break. It's like Sabrina and I's bladders have synced doing this radio show together.
TMI,
Yeah, okay. It's 9:14. It's KUAM News Takeover, Guam's favorite. Good morning.
Keeping you informed, KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the People's Bank.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc.
New self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Self-Storage, conveniently located near the Harmon McDonald's, offers fully covered loading and unloading area with individual pin-coded gate and door access. Call us today at 648-7867 for more information.
Specialist Joshua Manzanottia. I can't wait for him to come home. Keep us safe and stay home. I miss my daddy, and I can't wait to see him. So keep us safe and stay home.
Be healthy. Be informed with ITD.
Keeping you informed, KUAM News brings you Banking 671, brought to you by the Bank of Guam, the People's Bank.
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
The reason why we're having it at the Estumbo gym is because a lot of the targeted group that we're emphasizing on is living in areas, as I mentioned, that they don't have transportation. So we want to make sure that we cover these barriers to care. And so that's the reason why we want to do both the drive-through simultaneously with them walking straight up to our staff, and they'll have the nasopharyngeal swab. So we'll have three teams that will be working on this. The gym is ideal because also it's a gated, and we can control the traffic coming in and out. We also will have the tag. The tag will have her team with the National Guard to control the traffic, and also the security will be in place with our Guam Police Department. We'll also have the emergency response team there in the event anybody should have any emergency issues. And of course, one physician will be available during this time. We also have decontamination procedures. So we have to ensure that our staff, our nurses, will don all their PPE and they will decontaminate themselves as they get in contact with patients. And so in a nutshell, we're also going to advertise it through the mayor, of course, and our staff. And that information will be disseminated to them. And we're hoping that this pilot project, which we're aiming to just get a small count to start off with, as it's called pilot, so that we can be able to identify these areas that they may not have presented themselves to the clinic, because again, as I mentioned, they may have no insurance, they may be uninsured, they may have barriers to care like transportation. They can't get to the clinic for whatever reason. They don't have a car or they don't have anybody that can drive them. They can't take the bus or whatever. We're doing social distancing. So these are the reasons why we want them in these pocket areas. And so by getting that type of information, we can identify anyone that could be infected, regardless of their ethnicity. And once we identify if there is an infection there, we then launch our team to begin the investigation, to do the contact tracing.
924, little JD Crutch. Hey, good morning on you. It's the KUM News takeover of Guam's favorite containing COVID, 925. Let's go over to the phones where we have Dr. Juan Flores, the superintendent of Catholic schools. Good morning, Doc.
Good morning, Chris. How are you?
We're doing pretty good. I know that I got an email that said to get you on because you have some news about the Catholic school system. So here we are.
Great. First of all, you don't have to worry about calling me Doc because, I can't write prescriptions. So
yeah, I think especially with this COVID response, if I call you Doc, people are going to get the wrong idea.
Yeah, then I'll have to have a special mask or something. Right. So we'll eliminate that.
Okay.
I wanted to just make sure that folks know that the principals and the teachers in the schools obviously continue to work in the Catholic schools to keep the distance learning, but they're also struggling with a couple things right now. First of all, the end of the year is in sight, and so officially all schools will end on May 29th, but each school has a different final day to say that the high schools might have different activities that they want to continue. The elementary schools have different things they want to do. The other thing that's really critical, because it is the end of the year, is each school is now developing policies to determine how to make sure that students get a fair grade for the fourth quarter, and then how to fairly and effectively incorporate that grade into the grade for the whole year, because this is obviously unusual for most of the schools. So while this is always a busy time of the year for schools, it's especially challenging now for the teachers and the principals because of what we're going through with distance learning.
Right. I mean, I'm still trying to figure out how we're going to do exams and things like that, because my son, he goes to a Catholic school, and I really just don't know how this is all going to work out, because even before school was shut down, he had been sick. He had been sick for about a week, so he missed all of those exams. He went back and was trying to, take them, but then the school was shut down. And so, for me personally, I'm just really frustrated because I don't really know what's going to happen. And I really hope my son doesn't flunk the 5th grade.
Well, I'll tell you one of the things that's very clear from the principals, that whatever policy, whatever process they decide, they're going to go out of the way to make sure that no kids are at a disadvantage because of what we're going through. Even to the point where some principals have said to me, if we have to continue their learning process through the summer so they get caught up because it was so challenging. I mean, imagine if there are 3 or 4 kids in the home and they have one internet account and maybe one laptop, right? That means not every kid is able to do everything right away. Mm-hmm. So the principals and the teachers know that there are some challenges. And I keep encouraging the families that call me, go to the principal and say, this is our situation, and this is an accommodation we would need, and we would really appreciate some help. And I got to tell you that while it seems frustrating, I agree with you, it is frustrating We ask educators who are used to doing something in a certain way, some for as many as 30 or 40 years, to literally overnight switch gears. And it's like asking somebody who's only used to driving an automatic car, you give them a standard and you tell them, and you got to get to the hospital right away. It's been really tough for many of them.
Yeah.
I've watched teachers go through lessons on Google Classroom.
Mm-hmm.
And, we used to make jokes about how people who are challenged with technology, they don't know where the any key is. Do you know where the any key is, Chris?
What?
When you get to directions and it says press any key.
Oh. Yeah. Okay.
I'm here looking at my keyboard. Where's any key?
I'll just press them all.
Wow, I thought you guys would be riveted enough to know that one. Yeah. But so I got to tell you that for the teachers, that's what it's been like, right?
Mm-hmm.
But man, so many of them. I'm amazed at the number of principals who used to be challenged with trying to get my email messages, could get on Zoom conferences.
Mm-hmm.
We've all been forced to learn, and very quickly.
Yeah, my son learned how to do Zoom last week.
Yeah. Doc, Juan, what can you tell us about any adjustment in tuition? Because, let's be honest, a lot of parents are wondering why do they have to keep paying a full tuition when, they're not going to school. It's a pretty easy question to figure out.
Yeah, so there are two issues there. One is, the first issue is to take into consideration any families that don't have the wherewithal to pay tuition, right? And again, I send them to the principals because the principals tell me that on a daily basis, they are working those things out with the families, either in deferments or in discounts or figuring something out so it doesn't become yet another issue of anxiety for the families right now. The second thing is, I'm not going to compare what the teachers are doing to solid waste. I paid my bill the other day, and I realized, they're not collecting my recyclables, but I'm still paying the full bill. But I also understand that hopefully they're going to get caught up. I want to tell you that I think that the teachers are still earning that tuition, and that's the only way they can get paid. So I think that the families that are continuing to support the schools, God bless them.
Yeah.
And God bless them even though they have some questions and there are some challenges. And I think if the principals could cut the tuition as much as possible, they would do it. Right now, that's really a challenge. But the second thing, and maybe more importantly, those families who are challenged in paying tuition, please go to the principals. Give them some indication of why you think you can't make payments now, because the principals are taking those things into consideration. And it breaks their heart when the families should say, we're not showing up anymore, and they were never given a chance to work something out with the families.
Right. So one, it would be on the parents of the students to initiate that conversation with the school, with the individual school administrations. There's no blanket policy for all the Catholic schools. Say, hey, maybe. That's right. Maybe since, we're just going to chop tuition 50% or, there's going to be a system-wide deferral. So it's really up to the individual parents.
I have some experience working with another school system.
Which one would that be?
We won't get into that. But the Catholic school system is very different because it's a collection pretty much of independent schools. And the individual principals are responsible for the financial well-being of the schools. So I don't want to dictate to them what they should do. I'm just trying to provide them with support. Sometimes I think they're annoyed at how much I'm sending to them. I've tried to push them to apply for the PPP loans. We're trying to get them all set up on Hire Guam so that if they do furlough employees, those employees will be covered with some kind of unemployment support. And then we're looking to supposedly the CARES Act had some support to local school systems, and we're trying to see if any of that could go to the private non-public schools. So my job right now is to support them and to provide them with any advice and get them some resources as much as possible. So most of my day is spent talking to individual principals. And then every so often we have long conference calls. Right. You know, the limit on 45 minutes free Zoom conference calls, those went out the window the first day because we can't limit our conversations to 45 minutes. So the bottom line is go to the individual principal.
Right.
If you're challenged by, you know, most people have pride, and they might not want it. They might not know how to approach the principals without ruining their good relationships with the principals. Get a hold of me, and I'll talk you through what I think are good talking points to share with the principals, because every single one of them is concerned about the kids, and they don't want to lose the kids right now, and they want to be understanding of the families that are struggling right now. And there are many families that are struggling.
And I'm pretty sure the principals aren't, you know, I mean, they know what's going on out here, right? No one is insulated from this COVID crisis in terms of the financial impact it's had on so many of us.
Yeah, you know, one of the challenges right now is that, you know, most of our teachers, while they all have salaries during the year, those salaries are a lot lower than other teachers. And if another member of their family lost a job or has reduced hours at this time, there's not a lot of savings to kick in right now to help them out. So they're also going through it, and I think that they're expressing that to their principals. So that helps the principals to be understanding of what families are going through.
Have you got any complaints, Juan, from parents who, feel like they're paying the full tuition, or they're being asked to pay the full tuition, but they've now become essentially full-time teachers for their kids? And I'm talking about because I know some parents who have basically a big part of their day is dealing with all these assignments that are coming down from the Catholic schools. And I'm not saying, you know, parents shouldn't be involved. Of course, there's a lot of time to be involved right now. But what do you make of this idea that, hey, I'm paying this full tuition, but I'm basically executing all these lessons plans? And I mean, you know, maybe some parents are still working. They don't have time for it. So how do you kind of gauge what parents are doing to shore up, all the things that they would normally get with a physical school setting? And how do you kind of leverage that against, do I still got to pay a whole tuition? Because I've heard from a bunch of parents that it's a common issue that comes up.
Yeah, and I think that's a great question, a great concern, Chris. I would say again to go to the principals and say, listen, we don't have the time to do this, and we're not getting enough direction from the teachers. And I'm not going to lie. I think there are some teachers who practically are having Zoom conferences every day with their kids to make sure they know exactly what goes on as far as lessons are concerned. Just giving out a set of assignments is not a lesson. That's not teaching. That's just telling the kids how to open a textbook, read the chapter, answer the questions at the end of the chapter. That's not really teaching. But some of the teachers have found ways, even with printed materials, to actually instruct the kids. And if the families feel they're not getting that, this is the same issue when kids are given homework, but the homework is not based on what went on in school that day. And parents are frustrated by that. And I would say that in the same way, they've got to communicate with the schools. I would suggest that the parents try to contact the teachers and say, you know, I can't do this. What can you do, or how can you help me so that my kids are not going to lose out? Because the message we gave out, the message we agreed on, I don't think I gave it out, but it was agreed by the principals. We're going to try to give the kids, to the extent possible, a fourth quarter of as much learning as possible, so that when the kids end this school year, they're ready to move on to the next step. Mm-hmm. They're ready to move on to the next grade, the next level, to graduate from high school. If they're given credits, they need to earn those credits. So if somehow a teacher is not helping the kids learn, I think the parents need to have a conversation directly with the teacher or the principals. And I know that a lot of what goes on right now is all the parents now have chat groups. And I think if the parents find a common concern about a teacher, go to the principal or go directly to the teacher and say, how do we fix this? Most teachers are not sitting at home twiddling their thumbs or catching up on Golden Girls episodes. They're not doing that. They're doing their work. but they need to know that they should be instructing the kids, and then they need to know that they should be giving the kids feedback on all the work that they're doing, so the kids have a fighting chance to learn from what's going on.
Hey, I got a question here from a listener. Carlo writes in, which schools have applied for the Paycheck Protection Program, and if that loan from the SBA is approved, will then discounts be considered for tuition? Good question, Carlo.
That is a good question. Almost all the schools have. There are only 7 archdiocesan schools, which means they're schools directly connected to the archdiocese. The other are sponsored schools that are run by, like, the School Sisters of Notre Dame or
like Mount Carmel or
Mount Carmel's in a special category, but most of those schools also got denied, right, because they ran out of money in the first day or so.
Wow.
So we're hoping that this new infusion of money into the PPP loans will help the schools. I think that if in fact there is money that can be released to the families, I think the schools will do it. But families should know, too, that not all the schools are getting all of the tuition. So, in fact, there are already discounts going out because not all the families are paying 100%. And the schools are dealing with that on an individual basis right now.
So which schools were approved, the PPP?
I'm not aware that any of our schools were approved.
But they applied.
Right.
But they all applied. Okay. And we encouraged them to apply because, and it may work now, the banks, when they were denied, all the banks wrote a paragraph, or at least a sentence that said, we're keeping your application. If more funding becomes available, it's going to go on the list of those who will be considered. So, this is probably where divine intervention is going to play a big role.
Light a candle.
Light a candle, say a rosary, make a special plea to the Lord.
Pray for your tuition.
Well, I don't know.
Who's the patron saint of discounted tuition?
I don't know. Our Lady of PPP. I don't mean that lightly. The Blessed Mother intervenes for us all the time, so she's probably working overtime right now because of us.
Maybe you're not praying enough, Carlo. Okay, Juan, anything else you want to add into here?
That's it. The last thing is that the high schools are struggling to figure out what's going to happen with graduation.
Right. Where are we on that?
Well, it's a wait and see. It depends on what happens when, the governor lets up. And they're not in a hurry to do anything that's going to jeopardize our health.
Right.
There have been conversations about, drive-by graduations or having people out in the field 6 feet apart or whatever. And I'm in that special group of people in 1976 who also had our graduations messed up, but we eventually got to come together and get our diplomas. I'm not sure if that's going to happen this year, so the principals are waiting to see what's going to happen. They're having conversations all the time and coming up with scenarios because they want the kids to make sure that their efforts, upon graduation will be recognized and they get to celebrate with their families.
All right, Juan.
I just had a question, and this is just because of how financially things have been going with the private schools. Has there been any hint or discussions about any private schools potentially not opening next year or closing down?
I think that's a valid question. I have conversations with principals, especially those that have very tight budgets right now. Those schools are run on a shoestring. There's very few luxuries. There has not been a conversation yet about any school not opening in the fall, if we open in the fall. So, and if our mission is to continue the work of the Archdiocese in bringing kids to God through the Catholic schools, I hope none of them will close, because they all have special populations and they all have special missions, and they're all worthwhile for the Archdiocese. Unfortunately, we could pray all we can, but the bottom line is the economy is probably going to dictate everything more than anything else.
Right. Well, there you go, Juan. Thank you.
Thank you.
Thanks. Take care.
Keep in
Talk
touch.
to you later.
You got my number. Anytime you need anything announced, when you guys are going to roll out that big pay your tuition now and get 50% off program, let me know.
Where'd you hear that?
He's just messing with you.
You've been saying more rosies than I have.
Thank you, Juan.
God bless you guys.
Wash your hands. All right.
The lady of PPP.
That was funny.
My God.
Zinger. Hey, at 9:42, it's the KUM News takeover of containing COVID. I'm going to take a real super quick break, and then we're going to come back and close it out with some people that we think are doing great things in the midst of this COVID crisis. It's 9:43, containing COVID. Good morning on you, Guam.
Dear people. Keeping you informed, KUAM News brings you Banking 671. Brought to you by the Bank of Guam, the people's...
KUAM News COVID-19 Takeover on I-94 FM is presented locally by Ambrose Inc. Be healthy. Be informed with ITD.
Self-storage, conveniently located near the Harmon McDonald's. We offer affordable rates, online payments, and auto bill pay for your convenience. Plus gate access daily from 6 a.m. to 9 p.m. Call us today at 648-7867 for more information.
Hafade Guam, Adriana Cotero here, and I am currently reporting from home. And I encourage every single person in this community to stay home. COVID-19 cannot survive if we do not feed it, and that means staying home and washing our hands. Now, I know I've heard people my age in their mid-20s say, it's okay, we're young, we're healthy, we have strong immune systems, we could fight it. That's not true, and we also don't know who we could potentially be exposing. The only way that we can fight it is if we stay home. It is our duty to stop the spread and to stay home. Be safe, Guam.
Go for it, Bree.
No.
Who sings this song?
I don't know.
Yeah, you should let him sing it. 9:47. The KUM News takeover of containing COVID. Real quick, we're going to go over the info for the pilot program community testing that's going to go down at Estumbo. Estumbo for you.
Okay, yeah, it's going down at the Estumbo Gym. It is a drive-through type of setup. It's from 9 a.m. to 12 p.m. and this is specifically for people who live near and around the Estumbo Gym, the Sagan Linazan housing area. There's about 80 homes there. That's about 400 to 500 families and individuals, but they're really just looking for people that have mild symptoms, cough, runny nose.
Also, those with pre-existing chronic conditions like diabetes, hypertension, any type of pulmonary or lung disease, cancers.
Yeah, and right now, Public Health's ECHO team is out there on the ground, knocking on doors, passing out flyers, giving people specific information about the drive-through testing. And again, that is at the Estumbo Gym, 9 a.m. to 12 this Saturday. But in the meantime, if you are at home and you are feeling these sorts of symptoms, feeling these COVID symptoms, feeling flu-like symptoms, you're urged to contact your clinic and go in and get tested. You can get tested either at your private clinic or at the public health centers in Dededo, in Arahan, and Barragata.
Okay, can I just dovetail off that really quick? Because speaking of testing, I know we got a guest, but Bev Test J Salas on our Facebook comment stream is saying, "Good morning, Chris, and happy birthday, Sabrina. The question is, how would a bed-bound individual be tested for COVID-19 as they are unable to go to the test sites?"
Okay.
Right.
That's a good question.
Well, actually, Mayor Zavares addressed that and said that the public health personnel in canvassing will, you guys got to say something, though. They're not mind readers. So if you have somebody who is bedbound or disabled, we did hear from Mayor Zavares that public health has committed that they will go into those houses or, near. They're going to go and they're going to test everybody who needs to get tested in that area. So I guess it would be on you to let them know if they're canvassing in your on your street or whatever. Hey, Tanana is bedbound. How can we get her tested? And then I'm assuming if she's bedbound, then she has pre-existing conditions or comorbidities that also, make her eligible for the testing.
Okay.
All right, 9:49. Hey, I just wanted to really quick touch on this. Comments here from Rosas. We are struggling. We need help from the local government, too. And then someone else had asked for an update on the stimulus checks. Again, the governor had said with the stimulus checks, now she's already advanced payments to those who earned under $10,000 in 2018. At least some of them. I spoke to a friend of mine, Tomas, who said that he had called and he wasn't getting one. So, again, I advise you guys, get a hold of Rev and Tax and see who you got to speak to there. But for everybody else, the governor has said around the first week of May, and that's all pending the federal approval of our local implementation plan of the paying out the stimulus checks. On the unemployment, now that one unfortunately seems a little less clear, as the governor had indicated that program could still be weeks away.
Right.
And, we've had the labor director, Dave, on. He's been very, very accessible. I shot him a message last night. Unfortunately, we weren't able to get him on this morning, and I'm assuming that's because he's probably in a million conference calls with the feds. I mean, so we'll try and get a hold of him tomorrow, and that's where we're at. And really, again, the media brought it up. We played the soundbite. I know you're hurting. I feel it, man. I see people out here trying to get the grab and go. People of the Salvation Army is seeing faces they've never seen before. Catholic Social Services is also doing great things. GDOE, of course, the grab and go, and then the commodities. But the local assistance available locally, funded federally, would be public health, whether it's the SNAP benefits or the cash assistance program. And I didn't know they had one. I actually asked Tess from public health to give me a little info on that, and thankfully she said the cash assistance program provides assistance to needy families with children, old age, blind, permanently and totally disabled individuals. The income guideline is based on a basic needs standard. She says for March 2020, the total new applicants and reapplication for that program was 93. For April 2020, as of the 21st, it was 110. And these are processed applications. Okay, and the amount of cash you get, I did ask her, I was like, how much cash do they get? She said it depends on the household size and the rateable deduction. So there are these programs out there, and we have seen an increase. The governor has said that 59%, there was a 59% increase in people who have applied for these benefits. What I'm concerned about, though, is getting messages from people who haven't worked in several weeks, but who still don't qualify because, like, we had heard it also, they factor in if you own cars, if you own a house, your assets, those all kind of go to your eligibility. And so we're finding out that there's a huge cross-section of our community, working class families, middle class families, who just obviously can't work. And so what are we doing for those people, I think is, we know, and I want to commend the governor for, taking the initiative and paying out these advance payments to those who earn under $10,000. That's about 6,000 people, and there are just many, many more who need that local help. And
she was also talking about during the press conference yesterday, I believe, about making more tax refund payments. I know that's something that also we've been talking about on the show. Yeah. So hopefully, that'll happen.
Yeah, and hopefully you'll get them paid, sooner than 6 months from filing. It's 953. And, and kind of speaking to this and the need for people to get food, we had talked earlier about farm to table, doing the drive-through farmers market at the Dead Hill Co-op. It's a cash-only thing, and what they're doing is making these crops from the local farmers available for people who need food. And I also want to bring Kristen from Guahan Sustainable Culture onto the show. Good morning, Kristen.
Hi.
Hi.
So I guess just first of all, I know we had touched base on your program. You guys do a GoFundMe, and this is to raise money to buy produce from local farmers who are having a hard time getting that produce sold and even getting it out to where it needs to go, right?
Right. So what Guahan Sustainable Culture is doing is purchasing excess produce that farmers couldn't sell at the market and then donating them to organizations that are feeding people who need food right now. So in the past 2 weeks alone, we raised $2,600 through our GoFundMe page from various donors who decided to give, anywhere from $10 to $200. And then we're using that money to pay the farmers for their goods. We've also donated 600 pounds in the last 2 weeks as well.
So you're seeing a lot of farmers that are coming to you for help?
Yeah, we did a call to farmers, and we're still doing a call to farmers to ask them if they have any produce, and we will buy it from them so that they don't have to worry about any food spoilage or not being able to have any funds to plant for the next harvest or the next set of produce to be grown.
Mm-hmm. And what sort of produce, have you been accepting?
So we've been accepting mostly basic stuff for now, so eggplants and cucumbers, petchai, but we're willing to purchase anything that will be, food, like good food meals for people who need it most. So even corn would be very helpful for us.
And what are you hearing from the farmers, Kristen?
So some of the farmers, when we first started this program, they were telling us that they were having a lot of produce going to waste on the vine because they didn't have any orders to fulfill because of the economic downturn caused by the pandemic. So when we heard about all this food going to waste, we thought about just purchasing the food from them with the money that we raised and then just donating it straight to organizations. So it's a way for farmers to not have any losses or to at least mitigate some of their losses and then reduce food waste out on the fields. More and more farmers are reaching out to us, telling us that they are willing to sell to us. And that's a really good thing because we are also seeing a bunch of people asking us where to buy produce or looking for produce for themselves because they don't really have access to other forms of money to go purchase foods at, let's say, a supermarket.
Right. Mm-hmm. And so these organizations that you're giving this produce to, what can you tell us about that and what they're saying about the need for it?
Right. So we are donating to 3 organizations so far. So that's Catholic Social Services, Salvation Army, and Oasis. And we're also working with a mayor's office to do a drive-through pickup for families who need it most tomorrow. And what they're hearing, of course, is that there are a lot more people coming in asking for help. And they are always grateful to have donations, whether it be fresh produce or canned goods, to help people who need it. I think they're really grateful for the fact that we are giving them fresh produce because, of course, those are hard to come by normally. And so it's helpful, I think, in their perspective.
It's an incredible program, actually.
Yeah, I think what we also want to do with this is to increase the food sovereignty mission on Guam, right? So often we're reliant on imports from the States, and we want to build an agricultural economy on Guam so that we don't have to rely on shipments from the States, especially in this time right now where we're not quite sure whether or not the food systems in the States are going to continue to uphold the amount of production that they're
That is something that we're seeing in the national news is, places because of the stand down and even because of the rapid spread of this virus, they're worried about food production. And then we're also seeing, I know they say that the ships are still coming, but I go grocery shopping. I try and, and I see there are shelves that are definitely empty.
Yeah, I've experienced that too. So I'm going shopping at supermarkets. I'm like, oh, there's not a lot of ginger this week or tomatoes this week. And those two those two produce on their own, they can be grown in Guam, and we can use those things in our backyards and our local farmers to sustain our population here. And I think this program is going to try to make this a longer program, so it's not just during emergencies of the COVID-19 pandemic, but into the future where we will have a more robust agricultural economy on Guam.
Tell us a little bit more about how people can get some produce tomorrow.
So for the produce tomorrow, we're working with the Barrigada Mayor's Office, and it's primarily for Barrigada residents who are not able to find any other source of income or any support in order to get food. So we'll be handing out around 50 to 75 bags for 50 to 75 families, and they can come at 8 o'clock in the morning, I believe. If you go to our website at gsustainable.org, we will have more information about that there.
Okay, Kristen, thank you so much
Thanks,
again.
Kristen.
They're on Facebook. It's Guahan Sustainable Culture. Appreciate the good work you're doing, and we just wanted to close the show with you and tell you and your volunteers, that you guys are COVID heroes. So thank you so much.
And real quickly, your GoFundMe, it's gofundme.com, and just
GSC-supporting farmers sustaining families. However, if you go to our website at gusustainable.org, we will have a picture that you can click on, and it will go straight to the GoFundMe page.
Okay. Thank you, Kristen.
Thank you.
Okay. Bye. Wash your hands.
Yes, I will.
Okay. All right, Kristen from Guahan Sustainable Culture, 9:59. Hey, just want to thank all of you guys for watching, viewing, sharing, questioning, commenting the show. As always, it's been a great honor to be on the radio here for you guys. It's just one of the COVID silver linings. Of course, going back on the radio has always been in the back of my mind, and I never imagined that it would be under circumstances like this. But I'm really, someone just shot me a message, hey, thank you for all you guys are doing at KUAM, but we're having fun doing it, and I mean, it's something we take seriously. So really just...
I know when we first decided, I went to you first. I was like, I got to talk to Chris. And you were like, yeah. I was like, okay. All right,
I was ready for that yesterday. So again, thank you for watching the show on all the platforms, KUAM TV 11, the KUAM News Facebook, of course. We got that audio stream on Docomo Channel 10. And I want to thank Ambrose and IT&E.
Bank of Guam.
Bank of Guam.
Thank you to Coast 360.
Yes. Thank you to our sponsors. This has been the KUAM News takeover of Guam's favorite I-94. And again, a happy birthday.
Thank you.
To Sabrina Salas Mantonani.
And tomorrow is somebody else's birthday.
Whose birthday is it tomorrow? Oh, girlfriend's birthday is tomorrow.
Oh!
Yep.
It's Jason Salas' birthday
AKA
tomorrow.
girlfriend. That's what we call him. So we're going to do I got a special birthday song for you, Jay.
Ooh, I can't wait.
It might get a little PG-17 in here.
Even
Does he get the guitar?
even with the work situation being where they are, is it too late for me to take an off day? if you've got something cooked up, that
you're not coming to work then.
Yeah, I may leverage that work from home option.
Right.
No.
Okay. Oh, there
See
you go.
Tomorrow.
So okay, it's 10 o'clock. We're KUAM FM in Agotnia, Guam. Good job today, Sabrina.
Good job, Christopher.
And we'll leave you a little bit of the boys of Rock Bottom. Reminds me of Guardians of the Galaxy. It's Come and Get Your Love. Gualosi Chris. Estevez.
Bye.
Be healthy. Be informed with ITD.